Good day, Prof. I can't hear you. I'm not sure whether it's my volume or
Okay,
yours.
it's
Yeah.
my side. Can
Okay.
you hear me now?
Can you please try sharing your screen?
Sure,
I've
will
granted
do.
you co-hosting rights. Okay. Can you put it on slideshow? There's
Sure. Um,
it's down just below.
yeah, and I'm just no, where it I'll get there. There we go.
Yeah, that's perfect.
Is that
Then
okay? I can do the
I
full
think,
screen.
yes.
Perfect. Thank you.
Yeah, I think we are sorted. You can stop sharing. Then you'll start sharing uh, after the chairperson has opened.
Okay,
Yeah.
will do.
All right.
Okay. Thank you so much.
Thank you, Prof.
Thanks. Bye.
Recording in progress.
Good morning, good afternoon, honorable members. Good afternoon to our team that has joined us. I have set up my video to be on, but for some reason, let me see, what is it showing here? This video is not allowing me to be on. I will have to rely on some other people who are much more knowledgeable than myself how to put it on. But anyway, let us move on. Good afternoon to all of you staff members, Department of Health, those other officials who have joined us into this meeting. I do notice that the first presenter is already a co-host into this meeting. But in welcoming you members, let me thank you very much for your dedication and support. Yesterday we had a long meeting, marathon meeting, but you managed to now come and be part of this meeting. We thank you very much. We do have 3 presentations for now, and we would like to maybe start by having opening meditation, and then we take it from there. Thank you very much, honorable members. Ms. Machalamba, may I revert back to you to then indicate to us who are the honorable members who have joined today? Thank you.
Good afternoon and thank you, Chair. Present is Dr. Tlomo, Ms. Kleko, Ms. Clark, Dr. Leroux, Mr. Mutubatse, Mr. Van Staden, and Dr. Litlap. Thank you, Chair. I haven't received any apologies so far. Thanks.
Please record the late joining in of Ms. Sine. Honorable Sine is going to be logging in as soon as she arrives. She's flying out of Cape Town, but she does phone me. I encourage her to send that apology to you. That's fine. Thank you very much. Welcome, honorable members. We do have 3 presentations today. One is going to be started by a gentleman called Panet Valodia. Let me just indicate, honorable members, our bill is a South African bill with an interest and a flavor of some of the other people in the world. Some of the people who are coming in here are some of them related or associated with certain companies that have an interest in this manufacturing of these products. So I'm just setting the scene in so that there is no information that, like what was said last time, that what is it that brings international guests to this platform. They are also, some of them are actually helping us to understand these things better. And we are also planning ourselves to visit other countries where we can learn this better. So it is in that spirit that we are saying, let us allow and be part of these engagements with even international guests. Let me then welcome Professor or Mr. Valodia, who is going to introduce himself if he's a solo presenter or his team. And you do have 30 minutes from now. And after 30 minutes, we will then have to stop you, or you'd have wrapped up. We will then engage with your presentation as portfolio committee members, where we'll have a pen and paper and come back to assist us with responses to those presentations. So your 30 minutes starts now. Thank you very much. Over to you.
I would like to share my presentation, Chair. Thank you. Can you see the full presentation?
Yes, sir, we can.
Thank you. Thank you so much. So thank you, Honorable Chairperson and Honorable members of the committee, for the opportunity to present to you today. My name is Praneet Valodia. My company, Praneet Valodia Consulting, is involved primarily with innovation, including new technologies such as medicines. So the title of my presentation today is The Scientific Basis for Differentiation Between Combustible and Non-Combustible Nicotine-Containing Products. So the objective that I have today is to provide you with independent evidence from reputable organizations and also to dispel some of the misconceptions using scientific data. So I'm going to go to my next slide. Sorry, it's not moving. Let's just check what's happening. There we go. So this is my disclaimer slide, and I'm going to read the slide to you as I believe it's an important slide. This presentation reflects my personal views and does not reflect the views of the various companies and organizations that I'm affiliated with. I currently serve as a healthcare consultant to numerous companies, nationally and internationally, including Philip Morris South Africa. So I do not represent business interests or speak on any company's behalf. No one has seen my PowerPoint presentation before it was sent to the Portfolio Committee on Health. The outline of the presentation is to look at the differences between constituents, combustible cigarettes, and non-combustible nicotine-containing products, to look at the efficacy and safety of these non-combustible nicotine-containing products, and then also to discuss the reasons why tobacco harm reduction should be included in the bill. So I'm sure that most of you are familiar with the different interventions. I'm not going to go through this or describe them, but the non-combustible containing products that I'm going to discuss today include e-cigarettes, snus, heat-not-burn technology, also called heated tobacco products, and nicotine pouches. Nicotine pouches were authorized for marketing by the FDA this year. I just would like to refer to snus, and manufacturers are allowed to make a certain claim. And I'm going to read this claim to you. Using general snus instead of cigarettes puts you at a lower risk of mouth cancer, heart disease, lung cancer, stroke, emphysema, and chronic bronchitis. So there are a number of organizations that support tobacco harm reduction, and I'm going to refer to a few of them. Firstly, the FDA is the world's leading authority in the regulation of medicines and tobacco. The Cochrane Collaboration is also the world's leading authority in producing high-quality evidence that informs high-quality evidence for systematic reviews that inform decisions. NICE is the National Institute for Health and Care Excellence. They're also the world's leading authority in providing guidance and also technical advice on new technologies. So I'm going to focus today on the evidence that is produced by the FDA and the Cochrane Collaboration. However, there are a number of other organizations that support tobacco harm reduction. For example, academies of science, engineering, and medicine. They advise the US government. Yes, Public Health England, the Tobacco Advisory Group of the Royal College of Physicians, Cancer Research UK, University of Oxford, and these are just some of the organizations that support tobacco harm reduction. So very briefly, the focus of tobacco harm reduction should be on the 11.5 million smokers in South Africa. This is where the public health problem is. We tend to focus nearly all our attention on the smoking and vaping by youth, and maybe that requires some consideration. So this slide indicates the difference between combustible cigarettes and non-combustible nicotine-containing products. So let's start with combustible cigarettes. Here you have combustion of tobacco. There are about 6,000 to 7,000 chemicals produced, 100 of which are harmful or potentially harmful chemicals. On the other hand, with the non-combustible nicotine products, no combustion of tobacco takes place. This is very important. There's no combustion of tobacco. Hence, chemicals are either absent or less chemicals are produced. And the FDA has shown that in this one product, there's about 60 to 99% less harmful and potentially harmful chemicals. The amount of nicotine is the same in the combustible cigarettes and non-combustible products. However, the nicotine is not the substance of concern. It is these 100 harmful and potentially harmful chemicals that we are concerned about. Now, the FDA uses for its marketing authorization a parameter called relative risk. So relative risk is the risk between combustible cigarettes and non-combustible nicotine product. That's an important parameter. The FDA also uses a parameter called APPH. This stands for Appropriate for the Protection of Public Health, to inform the marketing authorization to determine the net benefit to public health. So this net benefit to public health is done by taking the benefits and the risks into account for the population as a whole. And this includes the youth, young adults, and vulnerable populations. So I want to emphasize here that this parameter already takes into account harm from initiation or harm from non-users using the product. So the question I have is that in South Africa, have we considered, like the FDA, all of these particular parameters that have been listed over here? So what I'm going to do now is to look at the FDA evaluation of two products, a heat-not-burn technology and an e-cigarette. So the references are provided. So for this heat-not-burn technology, there's a 82% reduction in carcinogens, 91% reduction in respiratory toxicants, 94% reduction in reproductive and developmental toxicants versus combustible cigarettes. So you can see here there's a huge reduction in toxicants in the aerosol of the heat-not-burn technology versus the smoke of combustible cigarettes. A huge difference. Just in this slide alone, I would suggest that there should be differentiation between non-combustible products and combustible cigarettes. So I know this slide is difficult to see the contents, but all I want to do is just show you here that the FDA has evaluated each and every chemical independently in their own lab. And there are 3 pages of this information in the report that is available publicly. So the first column you will see is a whole long list of chemicals and the 2 other pages thereof. Then these columns are the chemicals in 32 brands of cigarettes in the USA. And then we have chemicals in the heat-not-burn technology. So what I really wanted to show here is there is a reduction. So you look at ammonia, for example. There is a 49.2% reduction in the heat-not-burn technology compared to combustible cigarettes. If you look at benzanthracene, there's an 88.6% reduction. If you look at benzene, there's a 99.1% reduction in the heat-not-burn technology compared to combustible cigarettes. And as you go down this column, you see 92.7, 64.9, 99.5, 97.6. So there's a huge reduction in the components in the heat-not-burn technology versus combustible cigarettes. And on that basis, we should have differentiation in the bill. So this is the relative concentrations in the heat-not-burn versus combustible cigarettes, still taken from the FDA report. And I have put this slide in specifically because heavy metals are often spoken about. And if you look in this first column, heavy metals like nickel, chromium, cadmium, lead, they're heavy metals. The second column indicates whether these metals are carcinogenic or not. And group 1, for example, means carcinogenic to humans based on this International Agency for Research on Cancer. They're the world's leading authority in determining whether a drug or chemical is
Sorry, Chair.
Sorry, Chair. Sorry, Chair. I can't hear.
We've lost sound, Chair.
Prof, we can't hear you. What is the story?
Okay. Can you hear me now?
Yeah, boo.
Yes.
Is it okay
Yes,
now?
yes.
Sorry, where did we lose? We can't, is it at this slide?
We're starting on the nickel, chrome, then
Okay,
come.
okay.
Yeah.
Okay, let me start there again. So, the reason why I include this slide, because there's often discussion of heavy metals in these products. So I've listed them here in this heat-not-burn technology. There's nickel, chromium, cadmium, lead. Right? In the next column, it classifies whether these chemicals are carcinogenic or not. Right? And carcinogenic, if group 1 are regarded as being carcinogenic to humans. And, the classification is taken from the International Agency for Research on Cancer, and they're the world's leading authority in determining whether chemicals are carcinogenic or not. So if you look at nickel here, although it's classified as carcinogenic, it was non-detectable in the heat-not-burn technology. Couldn't be measured. Chromium, also a group 1, non-detectable. Cadmium, group 1, non-detectable. Lead was reduced by 90.7% in this product. So the point here, and formaldehyde is reduced by 74.3 to 84%. So although these chemicals are regarded as being carcinogenic, they were not detectable in the heat-not-burn technology. Hence, I believe that there still should be a differentiation between the heat-not-burn in the legislation with regards to combustible cigarettes and non-combustible products. Okay, so now we get to the FDA evaluation for an e-cigarette. We just completed the heat-not-burn technology, now the e-cigarette. And I've chosen one example, and this information is all available on the internet. The link is given below. And you look at these chemicals over here, they were regarded as quantifiable in the mainstream smoke of combustible cigarettes, but were below the limit of detection in the aerosol of the e-cigarette. So you see this NNK and NNK here, they are deemed to be possibly carcinogenic, but they were below the limit of detection. So though they may be present, but in very, very small amounts. Harmful and potential harmful chemicals were reduced by 65 to 100% lower in the aerosol of e-cigarettes than smoke of combustible cigarettes. A huge difference. So I must say that there's also an increase in some chemicals in this e-cigarette, for example, propylene glycol and vegetable glycerin, and they are there to form the aerosol. But as the FDA has said, they were offset. These increases were offset by the huge decreases in the harmful and potential harmful chemicals in the average combustible cigarettes and are unlikely to raise toxicological concerns. Okay, so the abuse liability of e-cigarette was lower than combustible cigarettes. Now, the FDA indicated that there must be something else in combustible cigarettes that causes the addiction, greater addiction compared to the e-cigarette. The in vitro studies done by them also showed no mutagenic, no cytotoxic, and no genotoxic effects. So based on this information and the huge reduction in the harmful and potentially harmful chemicals, it is believed that we should have differentiation within the bill. So the Cochrane collaboration, as I mentioned to you, is a world leading authority on producing high quality evidence. And so I'm going to just present some information here. Here we're going to compare nicotine e-cigarettes with nicotine replacement therapy for smoking cessation. And the first column here is smoking cessation at 6 months to a year. This column, the second column, is events with nicotine replacement therapy and events with nicotine e-cigarettes. So what the results show here, that nicotine e-cigarettes were more effective than nicotine replacement therapy for smoking cessation. Also, when they look at adverse events, they showed that there was no difference between nicotine e-cigarettes and nicotine replacement therapy. So one often hears that these e-cigarettes are dangerous and etc., etc. But according to the Cochrane Collaboration's report, and they've done this for 8 years, probably in a row, they see no difference in the safety between nicotine replacement therapy, which is standard of care, with e-cigarettes. Okay, so this is another study showing abstinence rates between e-cigarettes and nicotine replacement therapy, very similar. And the reason why I included this here is that this is a randomized trial, which is the gold standard in clinical trials. And it shows abstinence at 52 weeks. Nicotine e-cigarettes was 18%. Nicotine replacement therapy was 9.9%. So there is a doubling of abstinence rates with e-cigarettes. They doubly more effective. Okay, so this is from the same study, also randomized study. It shows respiratory symptoms of e-cigarettes versus nicotine replacement therapy. Now, e-cigarettes, as you know, are inhaled, whereas nicotine replacement therapy can be given in gums, solutions, sprays, etc., patches. When these e-cigarettes, when the aerosol is inhaled, there was no difference in the shortness of breath and wheezing between e-cigarettes and nicotine replacement therapy. However, when with e-cigarettes, which are inhaled, there was a 20% reduction in cough compared to combustible cigarettes. There was a 30% reduction in the production of phlegm compared to combustible cigarettes. One often thinks that if you inhale something that is going to be more dangerous, it is not the case according to the results of the study. Okay, so I'm going to talk about smoking versus vaping and the impact on disease rates.
Sorry, Prof. Please assist us on your previous slide. What is your baseline? Is your baseline the smoking, the tobaccos? What's your baseline?
I'm not so sure of the baseline, but being a randomized trial, there is a comparison between groups. And so what it's doing here is comparing e-cigarette as a group 315 people, and nicotine replacement therapy as a group. When one looks at before and after studies, when you measure certain kinds of outcomes, one then looks at the baseline. And then you can track people either as a cohort and you compare to the baseline. Does that answer your question?
Yeah, move with
This is a comparison study. There's a comparator group involved. Okay. So smoking versus disease rates. And so what this shows is that what's the impact of smoking versus vaping on these three conditions: myocardial infarction, and for those who may not know, this is commonly referred to a heart attack, where there is damage to the muscle of the heart, stroke, and COPD. And you probably know that COPD is linked heavily to smoking. So the results showed that there was a 52...
No. Unpack this term. We are not presenting in a clinical conference.
Okay.
Unpack this term COPD.
Okay, sure. So what happens that when one smokes, and particularly over a long time, one could get this condition called chronic obstructive pulmonary disease, which is abbreviated as COPD. And what happens when you have COPD, there are 4 stages of COPD, and in the latter stages, the tubes, which the bronchi, can be remodeled and often difficult to treat. So smoking is well known to cause COPD. So this study is doing, it is now comparing vaping versus smoking in terms of the disease rate for COPD. And what it's showing is that when it comes to myocardial infarction, there's a 52% reduction in the odds of myocardial infarction from vaping compared to smoking. Stroke, there's a 35% reduction in the odds of stroke from vaping compared to smoking. And COPD, 54% reduction in the odds of COPD from vaping compared to smoking. So you can see here there's a huge decrease in the disease rate for these 3 conditions when one switch from smoking to vaping. Jay, is that okay? Did I explain that well enough?
No, that's fine. Yeah, we
So,
needed
fine.
that term. Just needed that term COPD explained first, then.
Okay. Thank you. Thank you so much for reminding me, Chair. Appreciate it. Okay. Then, as most of you know by now, that Sweden is about to be the first country where they will become smoke-free. And I thought I'll just briefly relate to this. So in Sweden, they've shown that lung death rates due to lung cancer was reduced tremendously. Snus is used in Sweden. There's a huge decrease in death rates due to snus compared to that in the European Union, where snus is actually banned. Big difference. When it comes to cardiovascular disease, there was also a big difference in death rate when you compare Sweden versus the death rate in the European Union, where snus is banned. So Swedish men have by far the lowest, about 3 times lower tobacco-related death rates, 3 times lower tobacco-related death rates from cancer and heart disease compared to the European Union. So there are some positive effects. To give you a balanced view, there are some positive effects of nicotine. Nicotine is a cognitive enhancer, appetite suppressant, increases energy turnover, and it's used for it's been well studied to be used for a number of other conditions as well. I thought I'd just mention there are some positive effects there as well. Now, this graph is the risk continuum for nicotine-containing products, which includes combustible cigarettes. And this is the Y scale is the weighted harm scale. So what this shows, and I wanted to show you this visually. So the comparator here, this yellow bar on the extreme right-hand side is for cigarettes, and that equates to 100% harm from cigarettes. And the blue bars here shows that the harm has been reduced for nicotine replacement therapy, e-cigarettes, snus, by a large amount. So the harm associated with these products, the non-combustibles, is a fraction compared to those that from combustible cigarettes. A huge difference. So often, Chair, I've heard members of the committee saying that harm is harm. This slide does not show that harm is harm. There's a huge reduction in the harm with these non-combustible products compared to combustible cigarettes. So the reason why tobacco harm reduction should be included in the bill, and that's what I'm motivating for. And what are the facts to say that? Firstly, nicotine is not toxic. The toxicity is not due to nicotine. It's due to the 100 harmful and potentially harmful chemicals that I've mentioned, and it's due to the nitrosamines, it's due to the polycyclic aromatic hydrocarbons, etc., not the nicotine. There's little or no evidence that non-combustible nicotine-containing products or nicotine causes cancer. Now, the best example that I give, I've looked at the studies, and the best example is to look at this link that I've given you at the bottom here, from the International Agency for Research on Cancer, and they do not list nicotine as a carcinogenic agent in humans. There's also little evidence or no evidence that these products or nicotine cause heart disease or lung diseases. Now, example of lung disease that I mentioned is popcorn lung and e-cigarette or vaping use associated. They call it EVALI. I'll refer to this in a short while. The non-combustible nicotine-containing products are not a gateway to smoking, and I'll come back to that in a short while. There's no evidence that nicotine affects brain development. All the studies that have been done so far are in animals, and there's no indication in humans, and the results cannot be extrapolated from animals to human beings. And this, I just put this as a link to this. What it shows here, this EVALI, that is, this term shouldn't actually exist because people died because of the THC, which is in cannabis, and the vitamin E acetate. And this is what killed the people, not the nicotine or the e-cigarette. So I believe that the principle of the bill should be based on what I'm going to say now. For non-combustible nicotine-containing products, one needs to assess the benefits and the risks for these products. So what are the benefits? I've gone through them already. Reduced toxicants, more effective than nicotine replacement therapy, which is the standard of care, similar adverse effects between e-cigarettes and nicotine replacement therapy, and also mentioned the reduced odds of diseases. What are the risks? Nicotine is not harmless and not toxic, as I just explained. Nicotine is addictive. Yes, it is addictive. Nicotine causes alertness. It causes mild euphoria, the feeling of happiness, excitement, focus, improved concentration. However, if you look at addiction with alcohol, the withdrawal symptoms there could be life-threatening. Alcohol causes all kinds of problems: liver damage, shrinkage of the brain, cancer, heart disease, family problems, social problems, trauma, accidents. The addiction between the two is not the same. Addiction with nicotine is not dangerous. Sorry?
We are left with 2 minutes if you're watching your time.
Okay, so we need to look at the net benefit to public health between, you need to weigh the benefits and the risk and look at the net benefit. When it comes to gateway to smoking, there's a huge decrease in smoking of 15.8% to 1.9% in young people. The decrease. So I can't say how it can be a gateway to smoking if the smoking prevalence has decreased. Then what I did was I reviewed the studies, the gateway theory, and you can see all the comments are made in all the studies and a whole lot of more comments. And my assessment at the end was the gateway theory is not supported by smoking prevalence in the USA and other countries. The smoking prevalence for youth is 1.9% in the USA, 3% in Sweden, 2.08% in South Africa. The smoking prevalence is low in South Africa. We should be celebrating the low prevalence of smoking in youth in South Africa. Okay, I was going to now start summarizing, Chair, why the bill requires differentiation. And these are the 6 factors that I have already mentioned for reasons why we require differentiation in the bill. So there's no time for me to now go through that, but I've already mentioned all of them to you. And I've summarized this in writing as well. And then the conclusions, Chair, is that we need a different, based on the science that I've now presented, we need a different regulatory framework for non-combustible nicotine-containing products similar to the FDA. And then I have a number of recommendations that I would like to make. This is the last slide. Chair, will you give me time to just read through this briefly?
Yes, quickly.
Okay. So the recommendations is that we need good policies, and these policies need to be evidence-based. We need consistency in decision making. You know, we need to decisions that we make here for tobacco and the alternative products relative to cannabis. We need very importantly, I think we need an independent scientific committee to evaluate the evidence, and the reports should be made publicly available. Because of all the misinformation that we have, I think this is exceptionally important, an independent scientific committee. The bill needs to be transformative, and I think one of the ways would be to include tobacco harm reduction. Maybe during question time, I can explain and give examples of why I'm saying all of this. We certainly understand, like the FDA, the net benefit to public health, which is a key component for decision making. We need to accept a certain amount of uncertainty. I have linked this to the precautionary principle, but we can discuss that if you like. We must consider unintended consequences. We must respect autonomy or choice of smoker is paramount. Review the penalties, and I can discuss that in the question and answer time if you like. Understand addictiveness of nicotine relative to other substances, like I compared nicotine with, say, alcohol addiction. And understand the gateway theory to smoking based on scientific evaluation. This stems from the fact that I've looked at a number of studies, I've looked at the design of all the studies, and I couldn't find evidence that vaping is a gateway to smoking. Thank you, Chair. Appreciate it.
Okay, Prof. Your presentation was elaborate, comprehensive. You have taken 5 minutes of your time for answering questions, so you need to really adjust that part, because I looked at your presentation. You had 28 slides. I thought you would cover it in 30 minutes, a slide, 1 minute, a slide. So you overshot by 5 minutes. We'll have to borrow that 5 minutes. We'll borrow that 5 minutes on your other last 30 minutes. Please make sure when you reply in the members' comments now, you are adjusting accordingly, because we have 2 other presentations after you. Okay.
Sure. Thank you, Chair.
Honorable members, here is the presentation. We have received it even much more earlier than today. I will now want to check Let me just check here. How do I? Okay, look for members who have got who are raising their hands. Okay, I see, Prof. You still have your. Okay. Yes, honorable members, please raise your hands if you want to interact with this presentation. Can't see any hands being raised for now, unless my gadget does not allow. Ms. Matalamba, are you seeing hands coming up from honorable members? Not yet. Honorable members, I await
Yes,
your
Chair. Yes, Chair. I see
honorable
hands.
Zungu. Eh?
Oh,
Yes, I
yes, I
see.
did. Okay.
Honorable Zungula is number 1. Honorable Dr. Letlape, you are number 2. Honorable Shabangu, we are number 3. Honorable Mutubatse, we are number 4. Let me check again. Okay, those are the ones I've seen so far. Yeah, you can switch off your camera for now, Prof.
Okay.
My hand is also, Chair.
Chair, there's lots of hands up.
Yeah, there's quite a few hands.
There's many hands.
Honorable Kumalo, you are next after Mutubatse. Honorable Chirwa, 1, 2, 3, 4, 5. Honorable Chirwa Mpungose, you are number 6. Honorable Clark, you are number 7. Who else am I leaving out?
You've missed me, member van
Hey,
Staan.
you always use your number 1. Honorable Van Staden, today you are number 8. Have I missed Keko?
Yes, you missed me, Chair.
Oh, so sorry. Honorable Keko, we are number 9.
And Dr. LaRue's also got his hand up. Chair.
Honorable Dr. Leroux, you are number 10. Honorable Mare, are you there?
Yes, my line is also up, Chair.
Honorable Mare, you are number 11. It looks like it's a full house and everybody would like to say something. Let me get to the honorable members once more in terms of once the other member ahead of you has finished, you just come in. The first one, Honorable Zungula, followed by Honorable Totale Tlape. Number 3 will be Honorable Shabangu. And number 4, Honorable Motubatsi. Number 5, Honorable Kumalo. Number 6, Honorable Chirampungose. Number 7 is Honorable Clark. Number 8, Honorable Van Staden. Number 9, Honorable Keko. Number 10, Honorable Dr. Leroux. And number 11, Honorable Mare. In that order, once the member ahead of you, honorable members, has done his or her share, you then come in immediately without me interrupting you. Thank you.
Sorry, Chair. Prof, can you stop sharing? Thank you.
Sure. Just one sec. Sorry, just one sec. I'm trying to.
Okay, if we start, Ms.
Okay,
Machalamba,
okay.
while you stop sharing, is there a challenge? Okay. All right.
Okay, thank you. Greetings, Chair, colleagues, and Prof, and everyone in the platform. I think it's very refreshing to hear a presentation that is speaking about science, because the issue of smoking and the impact it may have on health for an individual and the public is scientific at the end of the day, particularly in the context of science that is evidence-based instead of science that we, based on our ideological views, want it to be. I've got a few questions, Prof. The first one is with your last statement where you said there is no evidence or science that that proves that vaping is a gateway to smoking. Can you elaborate on that? Because from the other presentations we had, the biggest concern was the use of vaping as a means of initiating new smokers. So can you elaborate on how on that particular statement, especially in the context of the fear that accessibility of vaping, especially for young people, might lead the young people to take up vaping. After taking up vaping, then they'll move on to more harmful products like cigarettes. The second question is that you've highlighted that the bill must be transformative. What do you mean by this practically? And in terms of the public health and the objectives of the bill, what does that look like practically? So the third question is with the preamble of the bill, where the view is to say nicotine is toxic. What are the positive effects of nicotine, as you've stated in your presentation? And what is your general view on nicotine, on its toxicity, including on how nicotine can have good outcomes or can have good results for a person? Then the last question is, what do you think that penalties should be reviewed? Why are you making that assertion? And then the last question would be on the issue of illicit trade. Do you not have a view to say if you over-regulate the current compliant actors that are legal, that are compliant with the respective standards when it comes to the nicotine, to the tar, once you over-regulate them, there might be a spike in the illicit market whereby there's no regulation in terms of the tar per cigarette. There's no regulations when it comes to the nicotine. Put aside how it's illicit, it could be sold anywhere, but from a health point of view, the science whereby that sector, there's no regulation, so there may be negative adverse effects on an individual based on the fact that they've procured a cigarette that is from the black market, that does not follow certain standards when it comes to its production and the limitations in terms of the nicotine and the tar. Thank you.
Thank you, Prof. Just a few questions. One, the issue of addiction to nicotine, is it dose dependent? And should we be having a regulation about nicotine concentrations in e-cigarettes? The second question is, are there any places in South Africa where toxicological studies are being done, comparative toxicological studies, or are we reliant on studies from elsewhere? And just to paraphrase the question that we were asked, do you have any suggestions in terms of what the bill should look like? Have you got any regulatory suggestions that we could take into account in terms of what the final bill would look like? Thank you, Chair.
Thank you, Chairperson, and thank you, Prof, for this presentation. I find it interesting, though, that throughout your presentation, you reference your presentation in the institutions from abroad, countries abroad, and you did not include any African country or South Africa, though there are studies and there is a data that is published even on the South African Medical Journal. But you decided to ignore the studies and the data that is available in South Africa and other African countries. You can go to your UCT data that is published, and there's a lot. I can't even start mentioning them, but you only reference to the studies that were done in the abroad countries. And one wonders, how is this helping us as South Africans, parliamentary South Africans, in what we're trying to deal with? Because you cannot compare South Africa to most of the abroad countries when it comes to economy and stuff. But how do you expect this to assist us? Because we are a middle class, we are a middle income country, and you are only referring us to the studies that were done abroad. And again, unfortunately, Prof, harm is harm. I will repeat that. But the difference is that when you look at the poison, or there's a slow poison and there's a fast poison, but both is poison. Harm is harm. You use the theme no smoke, less harm. And are you aware that the vapes, the emission from the vapes can harm those that are nearby? And I hope you know that. And this is not just a vape. It contains harmful chemicals, and those that are used for flavors, the particles, the carcinogen, heavy metals, which can lead to respiratory issues, cardiovascular problem, and any other health problems. Regarding the non-combustible product harm and addictiveness, why did you choose to be silent on the harm that is caused by non-combustible and the addictiveness that is there on this product? Because in your presentation, I don't find where you are actually talking on this. Your presentation is very silent when it comes to harm and addictiveness to these non-combustible products. Can you tell us some of the harms that are caused by this product? If it's possible, when you respond, just to indicate, because I don't think that you can just go through the studies and look at these products and without noticing that there is harm from this product. Like I've indicated that it's the difference is a slow and a fast poison. I think I got a last question, Prof. Is there a reason there? I look at the pictures that you presented. You presented very selectively the pictures of non-combustible nicotine-containing products only, and not showing us the pictures of approved smoking cessation aids. And how would you suggest that we as South Africans regulate the non-nicotine containing products, realizing that the products are currently being supplied with no control and management, yet they are positioned and cessation products, even without evidence to support their effectiveness in South Africa, as you have shown, and it showed any data that to that effect. I'm sorry, I'm having a bit of a hiccup. But that is my last question, Chairperson. Let me pause there and appreciate the time that is given to us. Thank you.
Oh, thanks very much, Chair. Welcoming the presentation. I just want to hop on the harm is harm. In your experience and in your studies, what makes people to say harm is harm? What informs that? And could you extrapolate it and help us to understand why people arrive at this conclusion? You spoke about the unintended consequences. In your view, how would we avoid the unintended consequences that you have listed? Just as advice that you can give as to what is it that we need to do. You spoke about us looking at policies what are the suggested policies that you might throw into the head? And there's also the open and the closed vaping gadgets. What would be your advice in terms of us within the bill or enacting to prevent the harmful of the open gadgets that are circulating? Because anything that can be put there might be dangerous on the open ones, and the closed ones might give us a leeway. But what would be your advice, policy-wise, in terms of us closing this gap of the open gadgets? Thanks, Chair.
Thank you very much, Chairperson. Let me take this opportunity to greet yourself, Chair, and members of the Portfolio Committee, and the presenter that is online. Chairperson, let me also join members who have welcomed the presentation from the professor, but I'm just having only 2 questions, Chair, to get clarity on. In the presentation, Chair, especially in slide 11 and 17, the presenter is having the concern with the so-called unchecked minister's powers. Yet he mentioned as a reason only the 2020 exceptional circumstance on the COVID-19 pandemic, which is not related to the tobacco control provision in the current law. Then my questions, Chair, are that are you aware, Prof, that the powers provided to the ministers to regulate product standard is already contained in Section 3 and 4 of the existing Tobacco Products Control Amendment Act 23 of 2007 and in the Tobacco Products Control Act 63 of 2008. The bill is essentially consolidating the separate acts into one. Why was the minister not abused those powers for more than 15 years? Now you want us to believe our minister is so bad and will all of a sudden begin to abuse executive powers. In your slide 11, would it be correct to suggest that the cigarettes bought during the temporal COVID-19 sales ban were mostly produced by local manufacturers of cigarettes as government mistakenly allowed production factories to continue so as to save jobs and did not know there would be criminality that would illegally pass these cigarettes to consumers? These are my questions, Chairperson. Thank you.
Thank you so much, Chairperson. Greetings to yourself, to colleagues, to the presenter, and to staff members. Kamala Mona Lady Chirampungose from the EFF. I just have 2 questions, Chairperson, through you. Professor mentions that there's a need for a different regulatory framework for non-combustible nicotine-containing products that is similar to the FDA. So I want to find out if what the proposition is in relation to this. Is the professor saying that the current bill in its current form isn't sufficient? And if it's not, then where do we make additions? What are the direct proposals from the professor in regards to this? And secondly, the professor also speaks about that there's a need to promote non-combustible nicotine-containing products to adult smokers, which is where I find a bit of conflict, Chairperson, because it's not that non-combustible products don't have any inherent harm. They do. They do pose health risks, right? Various health risks at that. And I think we would be digressing to have discussions on which is better, which isn't. Both or nicotine and tobacco are things that we're trying to curb. We're trying to curb reliance. We're trying to curb dependence and addiction. And that cannot come with promoting non-combustible products. So how do you reconcile what the purpose of this bill is trying to do with also intending or proposing that there must be a promotion of non-combustible products? Because then we are working backwards. We're moving forwards and working backwards. So where's the reconciliation that puts the two, that aligns the two together, that we are trying to reduce use and addiction, and initiation of new users as well, with promotion of non-combustible products? Yes, that is it from me. Thank you so much, Chairperson, for the opportunity.
Thank you, Chairperson. Good afternoon, Professor, and thank you for your presentation. I have put my camera on just to show that I'm not a robot bot, but I will switch off once I have revealed who I am. Thank you very much. And just the following questions. Of the chemical produced by non-combustible, how many and which adversely affective health and how affects health and how is this currently regulated? What would you suggest as penalties of non-compliance? That's the first one. And then the second one is, I note the study cited in the terms of harm reduction, but you should note that there are some studies that found that long-term use of electronic cigarettes or vaping products can impair the function of the body's blood vessels, increasing the risk of cardiovascular disease. Reduced risk is still risk. And in your view, is enough being done to make vaping products as safe as possible? And how much attention are studies that show contrary proof being given? Thank you very much.
Thank you, Chairperson. Good afternoon, colleagues, and good afternoon, Professor. Thank you for your presentation. It's much appreciated. Only 3 questions from my side to you this afternoon. Excuse me. The first one is, does this bill have any benefits for public health? And do you think that this bill will be difficult to enforce? And if so, why? My second question is, if you believe that the existing tobacco legislation is sufficient, are you willing to work with the Department of Health to amend or strengthen existing legislation where necessary? And my third and last question is, would you say that, and I think you've also, you come down to this message, but I just want to make sure, would you advocate that vaping must be regulated under a separate legislation rather than the one we have currently before us? And if so, why? That's all for me. Thank you, Chairperson.
What number was that? I am number 9, but I'm free to speak, Chair, if I'm the one.
I was number 8. Thank you.
Okay. Thank you very much, Chairperson. Let me greet everyone in the platform, including the presenter, Prof. My apologies for not being on camera. It's the network problem that is facing me. My first question would be to you, Prof. Do you want me to believe that nicotine cannot result in cancer or any respiratory disease? Personally, I will not agree with you on that because I understand nicotine as a drug. So any nicotine containing product is harmful. That's what I believe in. What is also interesting to me is that since the introduction of this bill, there are companies that promote or suggest an alternative to smoking, suggesting e-cigarettes as harmless. I agree with Honorable Shabangu to say harm is harm. Also, Prof, in your presentation that I saw, you introduce yourself as a health consultant, which I believe the companies that you sometimes represent should be, or you are supposed to promote public health. But in this case, you came to make this presentation sharing your personal views. My interest then would be, why do you choose to be yourself now? And sometimes you are a representative or a health consultant for these companies. Some are tobacco manufacturing companies. But now, when you share your views, your personal views, you are talking about the alternatives to smoking. That confuses me, and you are also contradicting yourself. Because I think as a healthcare consultant, you should be joining those that are promoting public health. Also, in your profile, you are silent about African or South African studies. To me, my personal view is a study that is conducted in a different environment cannot produce the same results as a study conducted in another environment. Your interest or your scientific results are based on international countries, none from South Africa. Is it that Africans cannot do research? If it's that, why would you dictate terms for South Africans whilst there is no scientific research done by African or South African scientists? I also have an interest in that, and I would want to get your response around that. Also, you made some recommendations, Prof. And one of them is that we must respect the autonomy of the one who chooses to smoke. What are you saying about one who chooses not to? There's a primary and a secondary smoker. What are the rights of the secondary smoker if we allow anyone to smoke? Because some just smoke in public. Some respect and go to those places that are demarcated for smoking. But there are those that are smoking carelessly, some next to children, some next to other people. So your autonomy in this case is not doing justice to those that are secondary smokers, if you say there is autonomy. Also, on the issue of the bill to be transformative, I think you must, because you are saying it should be step by step, step by step. That will cost Parliament a lot of money or a lot of time to the department, because the purpose of the bill was to regulate both smokers and this issue of vaping. If you want us to separate, it's not the interest at the time. So some of your recommendations are not talking to the objectives of this bill. Also, I would like to ask you another question about what is different from your personal views that you are sharing here and what you do when you work as a consultant, because you decided not to say anything about your other responsibilities when you are doing that consultant's work. You are just sharing your personal view. I will be interested in understanding what do you think is common or differing in the approach that you have followed when you came to present in front of us. Also, the use of vaping, I think it's also addictive, because most of these vapes and vaping instruments are colorful, are attractive, and children will be addicted to those. They are even addicted now. That's why the regulation. I think I must stop there, Chair, and give a chance to the last speaker and to the professor to respond. Thank you very much.
Dr. Letape before the last speaker, Honorable Mare.
I was the second speaker.
I see. What was the last one now?
Dr. Leroux.
Yes, Dr. Leroux, sorry, Dr. Leroux, and then Honorable Mare, yes. Honorable Dr. Leroux or Honorable Mare?
Thank you so much, Chairperson. Seems like Dr. Leroux is having a problem. I want to greet the members, yourself, and then also the presenter. Chairperson, I'm very confused today. I don't want to tell you lies. I'm not a smoker. So for me, this thing is something new. I just would like to know what is the difference between a cigarette, an e-cigarette, and a vaping. And as I've looked on the presentation, it is like the presenter is favoring the one over the other one. And like the other speakers were saying that harm is harm, nicotine is nicotine. I just would like to understand is why is people saying vaping is much safer than ordinary cigarettes? Because I was in a plane one day and there was a couple with me in the plane, and this guy, even though it says no smoking on the plane, this guy couldn't stop smoking this e-vape, this vaping thing. And it was like he couldn't wait for the plane to stop to get off. So it means that vaping is addictive. Because this guy hid his face so that the attendant mustn't see him. So I want to understand, why are people pushing for this thing and saying that this vaping is less harmful than cigarettes? And then the other side, they are saying that a cigarette is bad, but vaping is just as bad for your health, because I was just reading earlier on about the damages that this vaping is doing to your lungs and all these things. So is there any warning signs for people buying this vapes, this e-cigarette that they call this thing, to say, because on a box of a cigarette, you will see, it will say harmful, it can cause cancer. Do the e-vape, the e-cigarettes or the vaping, whatever you call it, do they also have that prescription on to say, yes, a warning sign to say, if you use this thing, you might be able to contract cancer under? Because the presenter, for me, it seems like he's biased. So maybe I may be wrong, but I'm trying to get my head around this whole thing. Is that what is the difference between this? Because both of them basically is harmful and it can cause cancer at the end of the day. Thank you, Chairperson.
Thank you. I see Dr. Leroux is now back. Let's give an opportunity to Dr. Leroux. Oh, disappeared. Okay. Let me add my last comments. Is mainly of them have been covered by the honorable members. Professor, I would like to start by saying I'm not really comfortable with what you've shown here on slide, yes, on slide 2. I don't believe that none of the companies that you work for or you work with have had an educational program in you that makes you to be such an expert. So rather, it would not be. I mean, I don't know where to draw the line of these are my personal views, not influenced by my understanding and my representation of the industry wherever I have been. So I don't think the slide is helpful at all. I would have wanted you to not even to include it because it's not easy to differentiate you as, I mean, do you think this is just your knowledge of pharmacology and nothing to do with understanding the industry and understanding industry via the companies that are associated with the industry? No, that is a very thin line. Rather, you probably should not have included that slide. Really, that talks about these are my views of my knowledge of pharmacology, and that's it. I don't believe so. I really don't. And it's very difficult to draw that line. On the issues of differentiation, some of members have requested that you probably expand on that, and I would also be likely to be helpful. It will be helpful to do that. Your understanding and probably your statement to say the bill should be transformative, I was not thinking you are saying you should start all over again. And I thought maybe you are saying it's part of differentiation to say maybe differentiate what you would like the bill or the act to say about cigarettes, tobacco, the combustible one. What must it say about vapes? What must it say about hookahs or all others? So I thought maybe that's what you are saying. I was reading it in that space. It would have been helpful to, as we have extensively quoted other studies that are saying this on harm reduction, to have said there are other schools of thought that are probably not very strong on harm reduction, but are presenting this so that while you are an advocate of harm reduction, professor, you could probably have inserted some other views of those who are not that strong on harm reduction so that you could really be able to be assisted by that. You would have to probably make me under, if one were to sometimes consider vapes, there are some other presenters who have come up to assist us with this thinking that countries in the world have actually not been very supportive of the single use of vapes because not only of they are easily accessible by young people because of their price, but they are also environmentally unfriendly. And maybe that should then dissuade any country to say, while we are probably considering vapes, but not a single use because of these other issues. What would be your comments on those issues? Honorable, we are starting at 15:20, so just time yourself for 20 minutes, for 30 minutes, and then we will have to wrap up, Professor. Thank you very much. Professor, it's your time now. Thank you.
Okay, thanks very much. Appreciate it. Lots of questions, so I'll try my best to get through all of this. And 1, 2, 3, about 6, 7 pages of questions. Anyway, so the first one, okay, in terms of the first one was about evidence or science that vaping is a gateway to smoking. And can I elaborate on that? So, yeah, so what I did, I know this is a contentious issue. So what I did was I kind of looked at all the studies myself and I evaluated the studies. Now, what happened generally, there are about 50 criteria that you use to evaluate studies, and 34 of them relate to clinical trials. So I try to use that kind of experience to evaluate the studies, and there are 2 slides that I've included that show the kind of criteria that I looked at in terms of the evaluation. So yeah, so and the comments on there about how these studies, are so many mistakes with the studies. Some of them have to be redone. They come to opposite answers. Uh, but the bottom line is that vaping, smoking prevalence has reduced tremendously. Like I mentioned, the US is 1.9%, in South Africa is probably 2.08%, and the low smoking prevalence, indicates that just at that level, it's an association, it's not causality, and it shows that, vaping couldn't have led to increase of smoking if the smoking prevalence is so low. I hope that explains that. As a best simple answer, I can't go through all the studies and explain all the problems that I've had in evaluating the studies. The transformative side of things, and this is what I've learned from a Harvard professor called Michael Porter. And he was commenting on health in general, and he said the small changes that you make eventually doesn't make the big difference. So what I mean, maybe I should give you an example. If you look at, for example, maybe there's 25% of a restaurant would be area where smoking can take place, and you increase that to 50%, how is that going to impact the bowl? If we look at the broader picture, that in South Africa, most South Africans don't go to restaurants or cinemas, uh, and it's going to affect a small group of population. People like ourselves who are affluent, we go to restaurants. Majority of people don't go to restaurants, so it's not going to have a huge impact. We've had a bill about smoking in restaurants, which I support, but if you look at the prevalence of smoking in South Africa, it's gone up. So that's what I meant by incremental. We got to really think differently. And, Sweden has become smoke-free, the first country to become smoke-free because use tobacco harm reduction. We need to create a paradigm shift. And that's what we need. We have 11.5 million lives that we need to deal with. Okay. Positive effects. Yep, I mentioned about the positive effects of nicotine. Yep, the whole lot of positive effects. Lots of studies are being done about nicotine to help for schizophrenia and Parkinson's and et cetera, et cetera. In terms of toxicity, I think the question was in terms of dose. And there was a question about dose. Yeah, so one of the issues that nicotine is given in an aerosolized form at a particular dose. And in that dose, it is not regarded as being toxic. Yes, nicotine is toxic. If someone ingests it orally or if they inject themselves, and I did a paper on nicotine, I could find one study where someone injected themselves. So it can be toxic in that anything can be toxic. Even if you take paracetamol, if you take in large doses, it is toxic. So yes, nicotine can be toxic in very large doses, but not in the form that is being used in these particular products. So yeah, and as I said to you also, that one's got to understand the addiction regarding nicotine. Everything. Maybe I should make a general statement here because I think it helps with a lot of the questions that have come up. Well, it's all about, and I might just say that what I've been doing is that I've been involved in this evaluating new technologies for 25 years. I've been chairman of Drugs and Therapeutics Committee for 15 years in South Africa. And, we use a specific approach. We start with the FDA, we start with Cochrane, but then we do our own evaluation within the country in South Africa. But the huge thing is that one should always compare. There's always a comparator that one needs to look at. We cannot, and that's the point I was making. You can't just say something is toxic. You've got to look at what is the toxicity relative to combustible cigarettes, because we're aiming here for people who are smoking and they're already getting nicotine. So, by getting nicotine in an e-cigarette, theoretically doesn't make too much of a difference because they are smokers. They've been getting nicotine for the past 20 years, maybe. What we're doing here is to swap them to an e-cigarette, which also contains nicotine. But as I said over and over, that nicotine is not the dangerous substance. It is the nitrosamines. It is the polycyclic aromatic hydrocarbons and all of that that is dangerous. And it's not the nicotine. I think that's one point I really try to make clear in my presentation. The penalties, yep, I think the penalties, they seem to be quite drastic. And I'll just think of myself as a healthcare professional. I have a moral obligation if I know that there's a product that is going to benefit people. So there's sufficient evidence that relative to combustible cigarettes, these products are 66 or 60% to 99% safer. I cannot ignore that because of less toxicants. I even showed you the toxicants in the one example of heat-not-burn technology, how they were reduced. I cannot ignore that as a healthcare professional. I cannot ignore that the efficacy is double that of nicotine replacement therapy. There's a randomized clinical trial. The world's leading organization, Cochrane Collaboration, has shown that. I cannot ignore that. I cannot ignore the safety of these products. It's not more dangerous. There's no evidence to show it's more dangerous relative to combustible cigarettes or even a nicotine replacement therapy. So I have a moral obligation to inform a patient, for example. Now, if I understand the bill correctly, if that bill was passed and I go and talk about this, which is based on evidence and science and reputable organizations, I could get imprisonment for 10 years. Is that fair? And that is the kind of thing I was trying to get at. If there's this evidence that I presented to you, it cannot be ignored by any healthcare professional, for example, and the public. The illicit trade, overregulation, we've seen in many, many examples that if you overregulate, and even ban, not even overregulate, even ban, we've seen examples of a huge illicit trade throughout the world, and Australia is a good example, and many other countries as well. So yeah, overregulation is also not feasible, and patients, as I said, also need to have choice in terms of this product. They need to be informed that there are safer products than combustible cigarettes. The key thing here, two things. The one is that it's about relative risk. The only comparison that we use here should be the combustible cigarette. Relative to that, the target population are smokers. And so one needs to have a focused evaluation in terms of this. How can illicit trade be resolved? I mean, there must be more stringent, I think, regulations regarding that. And, these products, if they're safer and all of those things, as mentioned, they should be accessible and affordable to the public to prevent the illicit trade. I hope that answers that question. Okay, let's go to the next. It's about addiction to nicotine. Is it dose dependent? Yeah, so toxicity is dose dependent. As I said, nicotine is not toxic, dose dependent, but the addiction doesn't necessarily have to be dose dependent. The nicotine is sometimes obtained like in the e-cigarette via an aerosol. It's a small concentration, and yes, one can become dependent on a lower dose of a substance. Question about toxicological studies in South Africa. Yeah, maybe I should just enter this question about, what about studies in South Africa, etc. Now, unfortunately, there isn't probably enough money vested in South Africa for us to be able to do the research. As I said, I chaired many committees in terms of we use overseas, unfortunately, we use overseas information because we don't have enough local information. It costs a lot of money to be able to do good studies within our country, and all the things that I've spoken to over here today, I haven't seen local studies. So hence I couldn't present you local studies because I haven't seen them. If you have any of those, please let me know. I know there was a study last year done by UCT. I've evaluated the study in a great amount of detail. I must say I have done that. And so it wasn't a study that I could use in what I wanted to say in terms of differentiation between combustible cigarettes and nicotine-containing products. It wasn't applicable to what I was talking about today. What should the final bill look like? I think, I should just answer, the final bill, the missing component to me is tobacco harm reduction. The one needs to, based on the studies that I presented today, and there were 6 aspects. If you look at the last, the slide, we didn't get a chance to, I present 6 aspects to you there to indicate that we should have differentiation in the bill. And if you look at the presentation, it was reducing harmful substances. We look at efficacy, we look at the safety, we look at disease odds, to reduce COPD, myocardial infarction by huge percentages. I couldn't find the gateway effect, and there was no mutagenic cytotoxic. All of those combined would indicate that we need a different regulatory framework in South Africa. Okay, so what should the bill look like? The bottom line is that we can't treat, based on all of this information presented by world-renowned organizations. I mean, I can't see how we can treat non-combustible products like combustible cigarettes. With all this information that was presented to you, I can't see that. I really can't see that from my scientific perspective. So we need to include I would believe, tobacco harm reduction in the bill as the main suggestion. Okay. Why? Okay, I think I've answered why only abroad studies. We don't have local studies, and each study needs to be evaluated in a lot of detail. As I showed you with the gateways, I mean, it's a lot of detail that you need to look at. There are 50 criteria you need to look at. You need very, very well-designed studies to be able to do that, and that will cost a huge amount of amount of money. Look at the Cochrane report that I present to you. They've done this 8 times already before I've presented the results to you, and they refined it all the time. It takes a huge amount of resources. Why not SMJ? There was nothing that I could use from the SMJ. And there was also studies that I came across that just didn't present the right information. Harm is harm. I mean, I'm a pharmacologist and I can't understand the slow poison and fast poison and all those kinds of things. I've never come across that kind of understanding, so I don't understand that. Okay, and the emissions from vapes. I mean, if one is reducing harmful and potentially harmful chemicals by 65 to 100%, certainly the environment and it's going to reduce the number of chemicals you're going to have in the environment. So, the secondary kind of uptake of these chemicals is low. There are numerous studies that have dealt with clean air and comparison. So just theoretically and logically, if you don't have combustion of tobacco, you don't have all these chemicals produced, the air is going to be cleaner around you. Okay, silence on harm for non-combustibles. Now, I haven't been silent, I don't think, on the harm of non-combustibles. I've shown that, and as a Royal College of Physicians said, 5%, but I mean, it's a fraction of the harm. So it's not about harm for combustibles, and that's the point I was making in my presentation. Not about harm for combustibles. It's the relative risk between the harm for non-combustibles versus combustibles. So whatever we do, and I've been doing this for 25 years, it's relative to something on the market. And so, because we're targeting smokers, so it's a relative harm of non-combustibles versus combustibles. And once again, I've been silent on that. I indicated there's a huge amount of reduction in the harm with the non-combustible products. Okay. What suggested policy? I think I've done that. Prevent harmfulness of the open gadgets. So yeah, that was a cut. So it all like started from the Ivali story where the lung injury there was not caused by e-cigarettes, right? There's no such thing as Ivali. It wasn't caused by e-cigarettes. What happened there illegally, they spiked the e-cigarette with cannabis, THC from cannabis, and vitamic acetate. So that's no longer an e-cigarette, which has changed the formulation of it. And so since then, what they've tried to do is to have closed gadgets. So the open gadget, so I know there's some work being done. I'm not too up to date with that, but the idea was they would close the tank so that people cannot spike the e-cigarette with these harmful substances. The thing about unchecked minister's powers, I didn't understand that, and COVID-19 I never referred to, so I'm a bit confused on that question. And the minister is bad, and I never said any of that. And abuse of powers certainly did not say anything of that sort. I believe that what I'm trying to say is that all we need is a differentiation in the bill, and doesn't need to be a new bill. And another bill separately. What it should be, like the FDA has done, clearly after years of debate, you can incorporate it in the same bill, but differentiate within the same bill. So I don't think there's a need for a new bill at all. Need for different framework from the FDA. Is the bill not currently efficient? No, the bill is not currently efficient because with all the evidence that I presented to you from world-renowned organizations, there is a big difference between combustible cigarettes and non-combustible cigarettes. So the bill, in my view, certainly is not efficient. So I'm going through this, trying to answer as many questions. Why am I promoting non-combustible products? Because they have health risks. Now, once again, it's not about the non-combustible products on its own. It's about the non-combustible relative to combustible cigarettes. And I think we presented enough evidence to show that there's a big difference between the two. Okay, in trying to curb addiction. So nicotine is the substance that causes addiction. And as indicated, nicotine is not dangerous. And I gave you an example, and I've compared it with alcohol, for example. what we need to do is to get rid of the harmful and potentially harmful chemicals, which is, as I said, nitrosamines and polycyclic aromatic hydrocarbons and all of that. And I must say there's some been work done where I saw a snus 10-year report to the FDA. They've actually extracted these harmful substances that are cancerous from snus, for example. So there's lots of development that can be done where, as we make people aware of this, they would improve their formulations. So once again, it's not about, for me, it's never about the health risk of just the non-combustible. It's always relative to combustible cigarettes because the target here we have are the smokers. Yes, we are concerned about youth uptake and all of that, but that needs to be controlled very strongly with legislation, age verification, and the flavors and all of that, and that can be a long discussion. Yeah. So once again, I think a reconciliation of decreased use and addiction, I think I've answered that. Of the chemicals that produced by trying to understand, didn't write this quick well enough. I think chemicals produced by non-combustibles affect health. Yep. So, and that's the reason I spoke about that one slide, and that's what I really wanted to get across was the fact that yes, you may have chemicals in these non-combustible products, and but the important thing that it's less than the combustible cigarettes. Now, if you look at an e-cigarette, I mean, we said when you have combustion of tobacco, you have 6 to 7,000 chemicals produced and 100 harmful ones. But if you look at an e-cigarette, what does the e-cigarette contain? It contains nicotine. It contains propylene glycol, it contains glycerine to form the aerosol, and it can contain flavor. So there aren't really 4 basic ingredients and maybe some others, but those are the main ones. So, when you're using it, it's not like thousands of chemicals that one is being producing like you have in a combustible cigarette. So there aren't too many chemicals being produced. And as I took you through the process of looking at those and see, okay, they're classified as carcinogenic, but they're not detectable, so it really doesn't matter. So one has to look at perspective when it comes to this. Long-term use of e-cigarettes can impair function of cardiovascular disease. Yeah. So now there is also issues about this. I mean, I showed you the one about myocardial infarction, and there's a huge reduction. What was it, 52% when people swapped to vapes, and that was done. It was a reanalysis of what was done previously, and I've been through the study and all the criteria they've used, so I'm comfortable with what has been done. So there's the answer, a huge reduction in some of the cardiovascular effects. Now you may think about, and this is what often comes up, but nicotine does increase blood pressure. Yes, but it doesn't cause disease. Number one, it may aggravate one's blood pressure, but it doesn't cause heart disease. Now, there was also a study done that said that, you get heart disease, but that study was retracted because people had the heart disease before they even started vaping. And it was a huge mistake, and that it was in the Journal of American Cardiology, and that study was removed. So yes, nicotine does increase heart rate, for example, but once again, it's about relative risk. So if someone smokes, and there was a study done in 115 patients by University of Dundee, and British Heart Organization was involved. People were on combustible cigarettes for 2 years, and the blood pressure increased. When they took them off the combustible cigarettes onto vaping, the blood pressure did increase, but to a lesser extent. So that's important. So when you're taking a smoker who may have some who's going to get cardiovascular effects, but when you swap them to a vaping product, you're going to get increase in heart rate, but it's to a lesser extent. So what is important is a relative risk to look at that. So the answer is, and I've looked at studies, I still don't see, yes, increase in blood pressure, but causing cardiovascular disease, no, there's no strong evidence for that. Does the bill have benefits for public health? For sure. Not at this point because it's not incorporating tobacco harm reduction. And if that is the case, like what the FDA has done, it uses a parameter, as I said, APPH, appropriate for the protection of public health. And they have clearly indicated that if one incorporates tobacco harm reduction, it is going to increase public health. It will protect public health. So maybe that's a comparison that I can use. Is the bill sufficient? No. Without tobacco harm reduction, no. Am I willing to help with this? Certainly. Maybe I should just answer this question because it's personal to me. The question asked about, I am saying this, I'm independent, and I'm just jumping question because I feel it's personal. And that, why am I doing this for tobacco companies? And I'm conflicted, and et cetera, et cetera. And I can honestly tell you, there was no interference ever in the work that I've done. I can tell you that categorically at this stage. And I have been doing this work for a long, long time. Not in this area, but in many other areas in terms of innovation. And I said it to you, I chaired committees in regard to this. So I have the skill to be able to evaluate the study independently and put so I'm going to reiterate again. And I just want to make it clear to you in my slide that there was no interference in the presentation that I have done today. So I thought I would just clear that up front. And I certainly would be willing to assist in any way, and I would be always unbiased in my views. Do you want to believe that nicotine does not result in cancer? No, it doesn't cause cancer. It is not on the list that I showed you of the International Association. 15 presidents of the Society for Research on Nicotine and Tobacco have also indicated, past presidents, they're the world's leading research organization, and they say that it does not cause cancer. If you go to the WHO document to FCTC in 2014, they indicate there also that nicotine does not cause cancer. And respiratory disease, I think I've also given you examples of how it's actually benefited. Now, we've got to evaluate per product. I am not speaking on every product because I don't know the quality of the products and etc. But I'm speaking on products that I know have been tested, and these were the effects thereof.
You have 2 minutes to wrap up.
Okay, let me see what I can just. The autonomy is not doing justice. I don't understand that too much. Transformative bill. Yep. As I said, we can separate if you bring tobacco harm reduction in the bill. I think we've answered that one. Yeah, I mean, once again, it's about personal views and in tobacco companies' views. As I said to you, there was not an issue. I have my views, and there's always be my own views. Okay. So I'm just going through the notes to see what I can answer in the 2 minutes I have. Okay, why is vaping much safer than e-cigarettes? I mean, I think we've looked at you've got to look at the toxicants, you've got to look at the efficacy, you've got to look at the safety, you've got to look at the mutagenicity and all of those kinds of stuff. Yep. I've answered why is it less harmful than cigarettes? The labeling question about cancer, yes, that applies to cigarettes. But as indicated, there's no evidence that the e-cigarettes cause cancer, so there's no need for that on there. But there should be other warning signs. And also there's got to be targeted to smokers only and not to anyone else. I think, Chair, you asked about transformative bill. I did explain that with saying about, I gave you an example of in restaurants and cinemas, and when I mean transformative, it could be a paradigm shift in the way we do things, in the way we think, and we cannot be thinking in the same way we've been thinking all the time. Smoking rates in South Africa have gone up. So we've got to rethink things, and it's got to be transformative, come up with great ideas, things that will make a difference, that's going to benefit the people of this country and public health.
Thank you.
Okay, I think that's all, Chair. Thank you very, very much. I appreciate it. And I appreciate the opportunity. And thanks for the questions as well. Thank you.
Okay. Thank you very much, Prof. And thanks to the honorable members who've participated in engaging. Honorable members, we will try and keep to the time because other members have indicated that wherever they are, they may be shifting in terms of accommodation and transport and other things. So we will adhere to the 30 minutes presentation, 30 minutes of replies by the presenter. Thank you, Prof. Some of the information that you have provided will assist us in refining and completing this bill. The comfort space from your side is that you're not saying let's start another bill, but this bill may have to be accommodative of some of the things that you think may have been left out. Thank you very much for that. We wish you well. I hope that the next presenter, Ms. Machalamba, has already been given sharing rights while Prof is logging off. It's South African Tobacco Transformation Alliance. Have they been given sharing rights? If they have, honorable members, let's just walk about as they put their presentation and then they'll start. South African Tobacco Transformation Alliance, you do have 30 minutes to present your case. Honorable members will engage with you for another 30 minutes. Oh, sorry, maybe less or more, but you'll come back after that for 30 minutes responses on that. So over to you, South African Transformation Alliance. Thank you. South African Tobacco Transformation Alliance. That's how they are called. Thank you.
Hello.
While they are doing that, can I hear the voice of Dr. Leroux? Dr. Leroux, can you greet so that we can hear you and confirm? Because we missed you the other time. You said you were trying to speak. We didn't hear you. Hello, we can hear you. Yeah, I don't know whether you can do. Can you do better than that?
I'm hoping so. I don't know what's going on with my microphone, but can you hear me now, Chair?
Yeah. Okay. Yeah. Can I nominate yet? You'll be the first one to interact with this, so that if you're still having problems will then come to that. Yeah.
Thank you, Chair. You can hear me now. Can you see me as well at the stage?
Yes. Yes. Thank you very much.
Good. I'm glad I'm back on. For some reason, my microphone didn't work. Thank you, Chair.
Thank you. All right.
Chair, good afternoon. Can you hear me, Chair?
Yeah, you're mixing both English and Afrikaans. Yeah. Now we can hear you. Thank you.
Thank you, Chair. So I can continue. South African Tobacco Transformation Alliance.
Yes.
Chair, thank you. My name is Francois van der Merwe. It's good to hear your voice, Chair. Thank you for the opportunity to you and honorable members of the committee. I'll probably hear your voices as well later on. We know each other. Chair, I talk today on behalf of the whole value chain, which includes farmers, processors, and manufacturers of legal products in this country. I have 30 years of experience in the tobacco industry, Chair, from seed to smoke. I've been involved in Africa and the tobacco business for 10 years. I was the chairman of the farmers industry in Africa. I also represented the industry internationally, Chair, and I'm here to share my views and my experience. And I come in a spirit of helping the committee, Chair. I've been involved in this process since the very beginning, even before you came into power with your new committee, Chair, and the previous administration, when we started with the public hearings in August 2023 in Rustenburg in Northwest. I was present at that very day and throughout the 9 provinces and spoke at many of the hearings. And my objective was to try and assist the committee, Chair. And that is my spirit and the spirit with which I come here again today. Chair, what we have in front of us is a tobacco bill, which in our view is flawed, and I'm going to talk about that. We try to assist the committee as much as we can because I think you have a very difficult task, but also, Chair, you and your committee have a last chance. If we don't get our tobacco control framework right now, it's the last time because our tobacco control is actually embarrassing, and that's not something that we can be proud of. And I'm sure as South Africans, we can certainly get it right. Chair, I'm not fighting with the department. There are people in the department, South Africans, with whom I go back a very long time, Advocate Malbelo, Loratu, DDG Hunter. If we sat around the table as South Africans, I'm sure we would have come up with a NEDLAC report, for example, which would have been more helpful to you. But unfortunately, as some of the speakers also say, other influences brought us where we are. Chair, the committee faces a critical choice. Does my slide change, Chair? Can you see it?
Yes, we can see it. Thank you.
Thank you, Chair. We sit between the choice of legislation that unintentionally strengthens criminal networks, because that's what happens if you overregulate, if you go too prohibitive, if you go too far down the line, or if we make laws that are balanced, we can actually protect South Africans. We share your commitment to effective tobacco control, Chair, but the reality of South Africa, and let's look at South Africa all the time throughout this presentation, the reality is, and it's come up over and over and over again, and you know it by now, that only 30% of the market complies with regulation and 70% are controlled by illicit syndicates, Chair. So if you get it wrong, the 70% would love it, they would not comply, and you will just perpetuate the situation, and we do not have an opportunity or time to perpetuate the bad tobacco control environment that we have, Chair. The stakes are very high, Chair, and you, committee, if you get it right, then you get public health right, as well as the economic stability and jobs in the value chain, and it's possible to do all of that in once. If you get it wrong, Chair, if you go the wrong way with your regulation, with what's on the table for you, you strengthen criminal networks, as has been the case over the past number of years. And on the other side, the losers are legal business, tax revenue, public health. Everybody are losers then, because these are decimated by an illicit sector that dominates the whole market. Chair, our crisis is not legislation. Our crisis facing public health is an enforcement failure. We actually don't need new tobacco laws. We have a very good act currently in place, but it's not enforced. And that's why, Chair, there's easy access to cheap, non-compliant products. And this is the basis of our whole problem. We can write, and you'll remember at some of the hearings I said, you can write 5 new bills, Chair. As long as the market is flooded with cheap, non-compliant products, your health agenda will not be achieved and consumption will not be reduced. So it's a key element to open the door is to focus on eliminating illicit trade, because that's the key to successful public health. And we are not here just to criticize, Chair. I can tell you now that at NEDLAC, we tried to make proposals. We had a bill there which we marked up where on every single thing, the question was asked today as well, what can be done better? So we were constructive, we are still constructive. But in its current form, Chair, what is left of the legal industry will be decimated with no benefits, because if the legal industry is decimated and goes and close shop, illicit will go to 80, 90, 100%, and then your tobacco control is completely, you can kiss it goodbye with this current bill. So, Chair, I must say that unfortunately, you as a committee got a hospital pass from the department here because you got man and ball at the same time. The department, unfortunately, with the respect I have for the people as South Africans there, did not do homework, and they leave you with a very difficult task. So in our view, Chair, you can either send this bill back to the department and tell them to go and do their homework now properly, step by step, follow all the processes, do it as South Africans, and follow all the processes, and we will work with that. Or, Chair, you as a committee can lead with fundamental amendments that can work for South Africa. But the bill in its current form is not workable. Parliament has the power, Chair, to do a couple of things, to do economic protection over criminal enrichment, because that's what you do. If you get it wrong with your law, Chair, you're going to enrich criminal networks. And that's where we already are. The pattern is there, and it will be exacerbated and perpetuated. You can have enforcement, effective enforcement over policy failure. At the moment, Chair, we have policy failure because there's no enforcement. And that's why our health objectives are not achieved. We can have South African solutions over international templates, Chair. And once again, this bill, what is in front of you, is not a South African bill. It's an international template, and we'll talk to that. And then, Chair, we can have constitutional governance over executive overreach. It's a dangerous thing in this bill that the department wants to give the powers to the minister and a 15-man monitoring committee and excluding Parliament for the rest of the processes. No further oversight from Parliament, no regulations have to go to Parliament, and that's a dangerous sign, Chair, and I'm bringing this to your attention. You already know it. These are the issues that we will look at, Chair, during the course of the presentation. And all I'm saying is that the current bill is not fit for purpose for South Africa. The good news, Chair, is if we work together, we can make it work. And I am committing the whole of the legal industry today here on record that we are serious about the failing health tobacco control regulation in our country. And the fact that consumption of cigarettes is going up and up and up instead of down. Chair, I'm going to share 3 pieces of information with you from different institutions. Oxford Economics is the first slide. Next one is University of Cape Town, and the next one is Ipsos. I think Ipsos is also joining me with other colleagues in the industry because I'm covering such a vast list of things, Chair. Now, a lot has been said about illicit trade, Chair. I want to focus on not the exact number because it doesn't matter whether the market is 60 or 65 or 70% illicit. The fact is that various institutions using various methodologies, none of them will tell you as Parliament that illicit in South Africa is small or it's below 20%, where it should be. That is the point. If you look at Oxford Economics, and if you can see my cursor, Chair, you will recall at the hearings I told you that the total market in South Africa is around 35 to 37 billion sticks. Here we see Oxford Economics in 2022 putting it at 36.5 billion. So that's where more or less the consumption is. At that stage, only 13.5 billion were legal, the rest, in other words, illegal. Now, since 2022, Chair, the 13.5 billion tax-paid cigarettes have declined. It's become less and less and less. Consumption is remaining stable or even increasing. It has increased over the past couple of years. That only means that illicit is getting bigger and bigger, and the cheap products in the markets are getting bigger. So Oxford Economics also told us, Chair, on the right-hand side here, that just between 2019 and 2022, SARS lost 72.2 billion in taxes evaded, and the legal industry shred 36,000 jobs without any benefit. So tax losses and job losses, but with consumption increases. That doesn't make sense, Chair. So please just note that. Let's look at what University of Cape Town says. Professor van Walbeek. He plotted the illicit trade down to 2002, as you can see on the left here, and you can see the graph going up and up and up. In 21-22, Van Walbeek also says illicit is around 60%, as you can see there. On the right-hand side, the same. He says that consumption is around 35 billion. You can see the graph there, around 35 billion, and tax-paid cigarettes is around 13 billion. So another institution, a university, using different methodology, saying to you that the market is around 35, 36 billion sticks, and illicit is around 60, 65, up to 70%. The latest one, and the last slide on illicit research, Chair, is a study by Ipsos released about 3 weeks ago. You might have seen some of this in the media. And look at this, Chair. 76.6% of the retailers and wholesalers they surveyed selling cigarettes below the tax rates of 26 Rand 22. But I don't want us to look at 26.22, Chair, because nobody in the tobacco business will sell cigarettes only to cover taxes. You have costs in the value chain. There are tobacco farmers that needs to be paid. There's processing costs, there's labor, there's transport, there's distribution, there's margins for wholesalers and retailers. Look at the bottom here, Chair, if you can see my cursor. The shocking result from Ipsos, 80.4% of all cigarettes sold below the lowest economically viable price of around 33 Rand. Now, the 33 Rand is absolute minimum if you pay taxes. UCT, by the way, says that must be 35. UCT says you cannot sell cigarettes for below 35 Rand if you pay taxes. We as an industry are advocating for a minimum retail price of 37 Rand so that the prices in the market can go up and we can get rid of the cheap products in the market, which is stimulating consumption. Now, Chair, look at the table here where my cursor is at the moment. Bearing in mind the lowest economically viable price of around 33 Rand a pack. Look at the prices of cigarettes here, which is rife in the market. You see the brand names here, Royal, Chief, MC Menthol. 75 Rand, 85, 85. That's not for a packet, Chair, that's for a carton. That means it's for 10 packets. So 75 gives you 7 Rand 50 a pack, 8 Rand 50 a pack, 8 Rand 50 a pack. Now, I leave it with you, Chair. Simply here, it shows you that the market is flooded with cheap products. Last point I want to make on this slide, Chair, is we have heard throughout the process, and the department, even at NEDLAC, were reluctant to accept that illicit trade is the key problem here. And the narrative was also, it's not really our problem. We write a health bill, illicit trade is somebody else's problem. It's a SARS problem, it's a police problem. Chair, and that's exactly where we missed the point, because look at what's in the Tobacco Products Control Act. If you can see my cursor here, it's one of the things in the Tobacco Product Control Act. It's got nothing to do with SARS. It's in the Health Act, in the TPCA. You cannot, it's against the law to sell cigarettes at a reduced price. There, I've got the wording for you, Chair. The question is, why is our tobacco control in a mess? If it says in the Tobacco Control Act that you may not sell cigarettes at a reduced price, where's the enforcement? Why hasn't it been enforced? Now we want to write a new bill, which is 10 times more draconian, while if we enforce just this one clause, Chair, we would have been in a much better position. So ask the department that, and then we'll see what the answer is. On illicit trade, we'll last more comments, Chair. What I'm saying here is consumption is on the increase. The legal industry since COVID has declined by 40%. Now, Chair, if consumption declined and the legal industry also declined, we would have said, okay, it's for a good cause. But these graphs are going in opposite directions. Consumption is on the increase, but the legal industry is dying and standing in front of closing down. So that doesn't make sense. They should come down jointly. That only means, Chair, that the legal compliant industry is busy dying, consumption is going up, and that is as a result of illicit trade, which is slowly eating up the whole market and growing and growing and growing. Oxford Economics modeled, if you pass this bill in its current form, they say that 28,000 jobs more will be lost on top of the 36,000 already lost. And the fiscus lost over 24 billion Rand to illicit last year, actually after 2022. So 72 billion plus thereafter 24, 25 billion every year. So we see, Chair, that more than 100 billion Rand has been lost to the fiscus in the last couple of years with no benefit, with consumption on the increase. So, you can figure this out. It doesn't make sense. Look at the newspaper headlines. Mafia state looming unless state cracks down on illicit. Tax evading criminals tighten their stranglehold on the tobacco market. This thing is front page, Chair. It's top of the agenda. And you are now in the predicament of passing a tobacco bill with this background. But you have the opportunity to fix it. Chair, prohibition does not work. Let's talk about prohibition. And then the lesson from 2020 COVID ban is never again. Unchecked executive power led to constitutional violation and criminal enrichment. Why do I say this, Chair? That was constitutional violation at the time because that decision was taken to court later, and the highest court in our land found that decision to be unconstitutional. But it was too late. The damage was done. Criminal enrichment at the time, Chair, with the powers vested in a minister at the time, not going to Parliament, That the minister and the government decided to ban tobacco during COVID, and that handed the whole tobacco market on a golden plate, mahala, for the illicit operators. And they've taken over the market, and that's where we still are. So unchecked executive power, Chair, never again. This bill stops just short of a prohibition. In the previous presentation, it was also asked excessive regulation, prohibitive, and so on. We hear many times, Chair, that we are told, no, this is not a ban. We're not trying to ban, we're trying to regulate. No, Chair, with greatest of respect, this is very prohibitive, very restrictive, and stops just short of a ban. So let's look at some of those bans, Chair, in this bill that's in front of you. Plain packaging is nothing else than a ban on the use of trademarks and logos. And in a market with 70% illicit and non-compliance, Chair, I don't have to say to you what's going to happen. The illicit industry are waiting for this bill to be passed. I want to ask you with respect, Chair, why have none of the illicit players asked for an opportunity to address you as a committee? They won't, because they want this bill to be passed. Why? Because this bill is so extreme. It gives them so many opportunities for non-compliance, and they know there's no enforcement. Their attitude is simple: catch me if you can. And they've never been caught. That's why consumption is on the increase, Chair. So plain packaging gives the opportunity for counterfeiting because branding is gone. Government prescribes what must go on a pack. So it's easy. You just take what government gives you as a manufacturer. You take a well-known, reputable brand. You put that brand name on there. You put the plain packaging picture on there, and Bob's your uncle. You ride on the back of legal brands, and you grow market share even further. The other thing is, Chair, in a 70% illicit market, illicit manufacturers have the opportunity to not comply with plain packaging and continue with normal branding. So what's the point then? If you have no enforcement and you have normal branding and plain packs in the same market. And furthermore, Chair, price now becomes the main competitive tool with plain packaging because all packs look the same. There are also serious constitutional concerns, and the legal experts will be able to tell you more about this, Chair. But one of them is arbitrary expropriation of property. And I say this with respect, Chair, but if you pass plain packaging, there will be litigation. I can guarantee you that. And remember the COVID-19 court judgment, because you're going to expropriate property that belongs to brand owners and that does not belong to government. And on top of that, plain packaging is not fit for the South African market. Retail display ban, Chair. Once again, this is not a regulation. This is a ban. It's an outright ban. Once again, South African reality, 80% of all cigarettes are sold in the informal sector by thousands of small businesses, tabletops, roving vendors, spaza shops. And you see the picture here, if you can see the picture, Chair, on my screen. This is our 80%. We mustn't think about cigarettes, Pick n Pay, Spar, Checkers, fancy things like that. And that's how their display bans with, look, if you can see my cursor there, that's a first world country. That's big shops. That's our display ban, fancy cupboards where cigarettes are behind the cupboards. That's not South Africa, Chair. Here in the below pictures, that is 80% of the South African cigarette market. And the model of their business is to display their merchandise. Now you want to ban that? It's a non-South African thing. It's unworkable. It's unenforceable. And you're going to kill thousands of businesses. Chair, I want to say one more thing. We tried our best at NEDLAC to negotiate and get an exemption or a carve-out for the informal sector so that they can carry on displaying their products. The insensitive view of the government fueled by the NGOs was no, sorry. Small businesses will comply. They must not display their products. That's how much the department and especially the NGOs care about our society, the DNA of our society, how the informal sector is, because they are willing to let a sector die where thousands of businesses can go under and go and stand in the queue for grants, for social grants. That is certainly not what we want, Chair. Another non-South African thing. Public place smoking ban, Chair. This is not a regulation. This is a ban. This is 100% indoor smoking ban and a severely restricted outdoor ban. The reality of South Africa, 11 million adult smokers who have the right to reasonable regulation and where they can exercise their rights, and smokers and non-smokers can live side by side. That's why we have a 75-25 dispensation in certain indoor areas. It's not broken, Chair. Why do you want to fix it? Why do you want to ban it? But because there's no enforcement, the default position of NGOs and the department is, okay, let's just ban it. because it's too difficult to work out something and figure out something that can work. Let's just ban it. That's the default position. It's not a regulation, Chair, it's a ban. Proposals in this bill with this ban will chase smokers where? In the middle of the street, in dark alleys, around the corners. Where must they go? 11 million smokers have the right to smoke, knowing it's a harmful product, and need a proper regulation, as we have at the moment, Chair. And then, if not for smokers, Chair, let at least, if you want to ban smoking in the 75-25 dispensation, let vapers get that area, because that gives you an automatic transition mechanism in your regulatory framework where smokers cannot now smoke in the 25% areas, but vapers can use that product there. It's a clever thing to do. It's a smart thing to do, because you force smokers in a way to move from a more harmful product to a less harmful product. Once again, we tried this in good faith at NEDLAC. It was bluntly refused, and because there's no will from the NGOs or the department to figure out something more workable and more practical, the default is, okay, no, we just ban everything. Plain packaging for all products, no smoking for anything, vaping also banned the same way as smoking. It's not sensible, Chair. Single stick sales ban, it's not a regulation, it's a ban on the sale of single sticks. Single stick sales are widespread in South Africa. In fact, Chair, we talk about a stick market in South Africa because it's so widespread, and thousands of businesses make a living from that. Now, again, Chair, it will have a devastating impact on small businesses, because most smokers buy loose draws because they can't afford, a full pack. Now, we were told that no, this bill is not to ban single stick sales. Chair, well, I beg to differ. If you go and read the bill is very clear when it says cigarettes must only be sold in intact packages. It's there, Chair, it's there. So how do we say now we don't intend to ban? So we see this as a ban on single sticks. There's going to be devastating impacts if you carry on with that. And if you ban it, Chair, it will not take away the demand. The demand will still be there. It will continue. You will criminalize thousands and thousands of small businesses. Once again, it's not a practical market. It's not a practical thing for a market like South Africa. Out of touch, non-South African, impractical proposal in the bill, fueled from first world countries and NGOs who don't care for this country or don't understand this country. Executive, excessive and unchecked ministerial powers, Chair, and I see this as a ban on one of Parliament's most important powers. And I am sure, Chair, that you and your committee will make the sensible decision here. But what's in this bill is a ban on Parliament's responsibility for proper participation and oversight. Again, the 2020 reminder, when Parliament did not have the oversight, but ministerial powers were so excessive. This bill, Chair, puts all the powers in the hands of the minister and a 15-man monitoring committee, excluding Parliament. We have tried this at NEDLAC. We have tried there that we want parliamentary oversight. But the view from the department, and this is true, Chair, they want this to be the last Tobacco Act to be passed. Let's get this thing through Parliament. Powers vested in the minister and the 15-man monitoring committee, which will be 15 NGOs and anti-tobacco activists, and then Bob's your uncle. Never again do regulations have to go to Parliament. Parliament's got no oversight, no reporting to Parliament. This is a very dangerous thing, Chair. Banning the voice of business. Once again, you want to regulate the industry, but you don't want to involve them. It doesn't make sense. Section 13.3 prohibits any tobacco or vaping industry participation in this 15-member monitoring committee. It's very vague at NEDLAC. We were only told that the minister will appoint this committee, but businesses will not in there. Chair, if you're serious about a committee to assist the minister, at least make sure that committee's got teeth, it's got proper composition, the industry is involved there, legal experts are involved there, harm reduction experts are involved in there, enforcement experts are involved in there, and then you can have a proper regime with accountability and give it teeth so that you can get a check illicit and you can monitor and you can report to Parliament and all those things. So, Chair, and then the last ban that there are more, what I want to raise is the banning the concept of tobacco harm reduction. It's a ban on a golden opportunity to transition smokers to less harmful products. Chair, let me say this. If we lived in a perfect world, the quit or die approach by the WHO or the DOH and the NGOs was ideal. So if you keep smoking, you don't quit, you're going to die.
Mr.
smokers
Chairman,
want to
Mr. Fanza, I can bet you will not finish your slides. You will not finish your slides because you have 4 minutes to go.
Yes, Chair, I will finish. I will finish. So you've heard enough about harm is harm, the harm reduction. Do not let the opportunity pass, Chair, because this harm is harm fallacy must go out of the window. You must differentiate in the bill between tobacco products based on their risk profiles. And there is a difference between the risk profiles of products. Enforcement against illicit trade, Chair, just to say that the current act is not enforced. There are good things in this act. Under 18 sales is against the law, it's not enforced. Cigarette paper is prescribed by the Health Act, not Customs and Excise, it's not enforced. Bar nicotine readings are not enforced. Online sales of cigarettes is against the law, it's not enforced. Now we want to bring a bill with 40 plus provisions to be enforced. I leave you with a question, Chair. On NEDLAC, I want to make the point, Chair, that the department only went to NEDLAC because of your good work as a committee. You forced them to go there. They didn't want to go there. They went there in bad faith. They went there to tick a box, and they had no intention to negotiate. Because how do you get the bill sent to NEDLAC, Chair, when 95% of proposals from other social partners are outright rejected by government? That in itself tells a story. And then we were told at NEDLAC that enforcement has been successful in general. How do you make a comment like that when 70% of the market is illicit? Chair, and then the whole story of the NEDLAC report that's been changed at the end, it is the truth, we can prove it, and we would never have signed that NEDLAC report from business because of that. And that's why we only signed the NEDLAC report when we could make the reservations. And I implore you, Chair, and I ask you respectfully to read through our document of reservations which accompanied the NEDLAC report. We spelled out all our concerns there, and that's the only condition how we signed the NEDLAC report. And I'm sorry, Chair, I apologize that the NEDLAC report is not helpful to the committee because there's virtually no agreement. And that is not right. That shows you that one of the players on this field was not playing ball. And the main reason for that, Chair, is because the government positions were dominated by NGOs who don't understand the industry, don't understand the market. They go away from here. All they're interested in is to go and tell the world, look, we have passed a draconian bill in South Africa with plain packaging, with this, with that, with the other thing. We tick the box, we go to our paymasters and we get our money. That is not accountability, Chair. As South Africans, we will have to take accountability for proper tobacco control, a bill that can work, that can be enforced, and that can address illicit trade. And then we can all work together. And in 5 years, all of us can be happy. And still, Chair, outstanding socioeconomic impact assessment, outstanding cost-benefit analysis. I implore the committee, you're going to have to insist on these things and make sure it's not desktop exercises, it's proper research, it's proper cost-benefit analysis. Chair, if you pass this bill as is, I think I've spelled out the consequences of this. I'm sharing it with you with respect, because if we don't address the current market dynamics and the current market situation, we will fail once again. If we do to work together, we will transform this bill into effective tobacco control that targets the illicit market, which protects constitutional rights and economic stability, enforces enforcement accountability, Chair, and demonstrates that our South African democracy delivers South African solutions. We depend on you, Chair, as committee and as Parliament, to have oversight to make sure this bill is either sent back or amended, and I am committed and we are committed to work with you because we are seriously concerned about an illicit market taking over, consumption going up, and the legal industry providing jobs, paying taxes, and investing in this country is at the point of closing down. I thank you, Chair.
Thank you, Mr. Franso. Mr. van der Merwe, as you are rightly putting it, you have been with us throughout public hearings. You probably should be saying now, I now see that you are processing this bill, so you probably have closed the door of taking the bill back. And therefore, in recognition of that, this is how I would want to take it forward. But you can't still put a either or, that you think there may be a thinking of taking the bill back to where it came from. Number two, please leave that to us to conclude whether the NEDLAC report to us is flawed or not. Don't really give that judgment on that, because there's never been an expectation that there would be an agreement on business and labor and government on any of the network processes. This bill is pro-health, and pro-business will probably have some issues on pro-health bills. So let's just keep it to our views rather than to really make sure we buy a story that says the report is flawed. Don't make that judgment on a bill. It's your view. Leave it to us to decide whether the report from Network is flawed or not. Okay. Honorable members, may I request that you then indicate those who would like to interact with the presentation, and I will recognize hands that are going to come up on the platform and give you numbers accordingly. I agree that Honorable Dr. Leroux will be number 1 this time so that shame with disadvantage. And then Dr. Leroux, number 1. Honorable Van Staden, you're number 2. Honorable Clark, you're number 3. Honorable Kumalo, you're number 4. Let me just check further down. Okay, honorable members, can I get more hands? Did I miss out anyone? I'm paging through here. Okay. Honorable Zungula, we are number 5. Okay. Any other member? Okay, Honorable Zungula, number 5. Who else can you shout if I miss you? After Honorable Zungula, who is coming? Honorable
Letlape's hand is up.
6. Honorable Dr. Letlape, your hand is up. Number 7 is Honorable Mare. Okay. I have 7 hands for now. I would always want to make one round. Honorable Dr. Leroux, you are number 1, followed by Dr. Honorable Van Staden, 2, and number 3, Honorable Clark, 4, Honorable Kumalo, 5, Honorable Zungula, 6, Honorable Dr. Letlape, and 7, Honorable Mare. In that order. Any other member I might have left out who maybe just shout if you can't raise your hand? Okay, none. Okay, start. Honorable members, follow one another. I don't have to come in between to ask you to continue. I've given you numbers. Thank you very much.
My apologies, Chair. Did you notice me?
Hand
Typo is
up.
also on the queue.
Okay, your hand is not up on the platform. Okay, Honorable Keko, number 8. Thanks.
Okay.
I didn't see your hand. Thanks. Thank you.
Thank you, Chair.
Honorable 9. Honorable Mutubatsi, you are number 9. Let me just check again. Honorable Chirampungo, so you are not on the platform. Oh, I haven't seen her hand. Okay. The last hand is that of Honorable Mutubatsi, number 9. Thank you.
Thank you, Chair. Are you able to hear me, hopefully?
We can hear you well now. Thank you very much.
Good. Thank you, and I hope you can see me as well. Thank you, Chair, and thank you for Mr. Van der Merwe for your passionate presentation. And yeah, thank you for the perspective that you've given, in a sense that from your side, that you're concerned that the regulations are going to have unintended consequences for the legal sector, and that it's and I understand from your presentation that you're concerned that it's going to push even more of the trade towards the illicit market. And so perhaps I wanted to just maybe ask some questions about the illicit market, because I certainly need to get some more clarity about it, and I also need to so perhaps you can help us with that. I think the first thing to say is, as the Department of Health, obviously it's not the Department of Health's responsibility to enforce it, but I do recognize that we have a public health responsibility to at least push for its enforcement. And so my understanding is it's primarily a police matter, and I like to understand why. I hear from, for example, the Small Traders Association that before 2020 there was some level of enforcement, but that enforcement seems to have disappeared. What has your experience been, and is it because the police simply are no longer visiting areas to check for illicit cigarettes, or what is the main issue in terms of enforcement? That's my first question. The second thing was just in terms of the minimum tax. Do I understand correctly when you say 26 rand 22 is if you sell a packet of cigarettes, 26 rand 22 is payable in tax before you even make any profit at all. So before you recoup costs and making profit at all. So if any cigarettes that are way under 33 or under 35 or under 37 rands are actually not viably anything that's under that price must most likely be illicit. So I just wanted to get an understanding about that. On the third question around the illicit trading is just, you mentioned that most of the illicit trade seems to be coming from within South Africa. And again, I don't quite understand how is this illicit? Are these illicit cigarettes? I mean, I totally understand and hear your argument that if we don't control the illicit trade, actually much of this new law will have no effect at all. And so I do think this is an important issue that needs to be clarified to us as a committee. Then lastly, again, about the illicit trade, you said that the plain packaging is of benefit to illicit traders. Now, I just want to understand the difference between, I mean, it seems that people can fake brand names just as well as they can fake plain packaging. Why do you say that there's a difference between the two? So I'm just trying to understand why you feel that that's even more to the benefit of illicit traders. If they can fake plain packaging with a name on it, could they not just fake a pack of Camel or Marlboros as well? Why is that different? So that those are my main questions. And then finally, that's around the illicit trading. And then in terms of your concern, again, I hear your concern around parliamentary oversight. I just want to get a sense what you would propose how this legislation should how the parliament should have oversight over this, and are there any examples of other laws that you can show us that would have a similar approach? I hope those are all clear. And yeah, thanks again for your presentation.
Thank you, Chairperson, and thank you, Mr. van der Merwe, for your presentation. Just a few questions from my side. The first one is, I want to know, what have you and manufacturers of tobacco in South Africa done on your part to address the illegal trade in cigarettes and tobacco currently in South Africa? My second question is, what will be the solution to curb the illegal trade in tobacco and at the same time take into account the health of South Africans? My third question is it your opinion that a retail display ban would in effect criminalize a portion of a retail sector? And if you can you just elaborate a bit more on it? My fourth question is, according to you, how many small traders and community retailers will be forced out of business when this bill come into effect? I think a presentation on a few meetings back, the person was telling us about 2 million people, but if you can tell me also what the numbers is with what you're having. My second last question is, and that's regarding legislation. Do you believe that there should be a balanced regulations that must be created that can be balanced out between vaping and tobacco? In other words, must be there separate legislation for vaping and separate legislation for tobacco? And my last question is it, according to your knowledge, was there ever a socio-economic impact assessment study done for this bill before this bill was drafted? And if not, why is it important that such a socio-economic impact assessment study must be done and bring before, say, Parliament and before this committee in order for us to complete our work regarding this bill effectively? That's all for me. Thank you, Chairperson.
Thank you, Chairperson, and thank you, Mr. van der Merwe, for your detailed presentation. I have been covered somewhat by the previous speakers. I would like to know from you, what clauses would you add, remove, or change to this existing bill if you had to make those recommendations? And then, of course, I think, we really are, as a committee, aware of the illicit trade, between 60 and 70% in this country. And it's very important that we as a committee actually have meetings with SAPS and with the SAPS committee, as well as Justice, and as well as SARS, because we really need to hear from them what are they going to be doing in order to deal with the illicit trade. Because as Dr. Leroux said, it's not for the health department to enforce laws in terms of criminality, but it is departments like SAPS and SARS that have to come and tell us what their plans are to mitigate this problem. And we all know from during COVID, with ridiculous regulations, exacerbated the illegal trade, not just in cigarettes, but also in alcohol sales. So it's something that we are very aware of, and absolutely need to still deal with that. And then what is your opinion on the electronic vaping products being regulated in the same way as cigarettes? What would you suggest that we could look at to do better? I thank you. And also, yes, I think Member van Staden touched on it, but I also want to know what the impact in terms of this bill will have in terms of jobs in our country, because we have the largest unemployment rate in this country, and obviously we do not want any unemployment to exacerbate because of laws that we will put forward. But we must also bear in mind that this bill also, in some retrospect, is addressing the health concerns and what smoking costs the health sector. And that is something we've also got to take cognizance of. Thank you.
Thank you very much, Chairperson. Let me also acknowledge the presentation and have some questions in relation to it. One, Chair, I want just to check with the presenter in terms of the information on how much profit is being made from e-cigarettes versus traditional tobacco products. If you have that information regarding the tax evasion issues, Chair, have the presenter presented these issues to the Department of Finance, as this is a crime? Chairperson, I see the presenter also referred to the COVID-19 ban. I want just to check, do you realize that COVID-19 was a pandemic that affected all sectors of the economy and even globally? Restrictions affected other sectors aside from tobacco products. For example, there were also bans on alcohol. Do you think for the purpose of the bill, it is relevant to alert us of the COVID-19 period, as this was not the normal era, and this bill is not banning tobacco products? Thank you, Chair.
Thank you. Firstly, also want to join in the colleagues on welcoming the presentation. I've got a few questions, and another issue I think will be a proposal to the committee based on something that has been coming out strongly in these presentations. The first question I have, the issue of illicit trade, there's always that view to say the illicit trade is a law enforcement issue, it's not a Department of Health issue. So the presenter, you spoke about how even in a network there was discussions on the issue of illicit trade. I would want to find out, on your view, what would be the role of the department to deal with illicit trade versus what is in the purview of SARS and the other law enforcement agencies. The second question, you made a statement to say 70% of the cigarettes sold are illicit, meaning, if I can say 7 out of 10. Now, if the bill wants to regulate the 3 that is not illicit, because the 7 is illicit for public health, practically so, is there any difference that will be made? Because I can imagine if a person is sick and there's a strain on public health because of cigarettes that are sold, when a person, the 70% that is illicit, when they go to the hospitals or clinic, there's never going to be a question to ask, were they buying or were they using proper cigarettes that are legal, or they were buying from the illicit market. Now, regulating the 3 from your perspective, is it practically going to help? Put aside anything, but from a practically point of view, you've got 70% that is illicit, you've got 30% that is currently in within the regulation. Now, when you introduce other regulations on the 30%, the entire tobacco sales or the tobacco market, which is 100%, if you now are wanting to regulate the tiny fraction of 30%, practically, is it going to assist the objectives as espoused in the preamble of the bill? The third question, you stated this bill is an international bill using a foreign template. Can you explain more about it? Because I find this very troubling. If we are going to be debating or discussing a bill that has been developed elsewhere in the world, and Tina, as South African citizens, we just need to, implement and enforce or impose down the throats of South African citizens. I find that statement very problematic. The standard branding and packaging on the bill, will it help reduce or enable illicit trade? The other question, 80% of the cigarette sales are in the informal sector, which is predominantly the Black people, who are the most poor, vulnerable group in terms of the racial demographics of the country. Now, if the bill is passed, what impact will that have on those citizens who are predominantly Black? The other question is saying, you keep on referring to government and NGOs. You speak as if they are the same or they are wearing the same blanket. What makes you make this inference? And, which NGOs are these? Are they local? Are they foreign? Can you please perhaps make us understand on the NGO part, whereby you tie them together? Because I've got a very, very big problem in having people who are not having a mandate to govern the country, but given space in terms of the government to impose or to lead policy discussions, whereas they do not have the mandate of the people. Because the people that have got the mandate of the people are the elected. It is the government, basically. Now, to have NGOs without any form of mandate, having a dominant say in terms of the policies of our country, I find that very problematic. The last, you made an allegation that NEDLAC report was changed. I do not want to enter into the discussion whether there was no agreement. I think it's a topic for another day. But for me, the part that is troubling is the changing of the NETLEC report, because what effectively means, it means NETLEC misled the committee, and misled Parliament, which is a criminal offense, by the way, based on what transpired in NETLEC. Because whether there was disagreement or there was no agreement, but one would want NETLEC to report to us what transpired, not take out some things or change some things, because theirs is to just say this is what transpired. That is what a report should be. Whether there was disagreement or agreement, that's another factor. But to have NETLEC to change a report, for me, I think it is something that is troublesome. And you did state that you have evidence to prove this. I would suggest, Chair, that perhaps we be furnished with this evidence that proves that NETLEC, misled, or NETLEC changed their report and inadvertently misled Parliament, by extent, it misled the committee, by extension Parliament, because it means now, even in the entire process of formulating this bill or processing this bill, once you've got tainted parts, which includes NETLEC changing or altering their report, there's a risk that we as the committee or the Parliament would be in trouble with the law, because the process would be tainted, and it would not be by our doing as a committee, but rather it would be by the doing of NETLEC. So can you please share more details on this? And from my side, Chairperson, on this, I would like us to probe this matter, because it's been coming out, and I think it would be amiss of us, or would be derelict of our duties as a committee, if we do not investigate the evidence. We're not saying they did it or they did not, but at least if we were to examine the evidence to check the accuracy or the correctness of that assertion, it would help the committee a great deal, so that we know, when we look at that NETLEC report, we know what lens to look at, we know what lens to use, because we'll know whether it is a report that is tainted in the sense that it contains mistruths, or it is a report that is a true reflection of what transpired. Thank you.
Thank you, Chair. My question, there's this issue about economic impact, and we're concerned about the effects of tobacco, but we should also be concerned about the effects of poverty, food insecurity, and joblessness. How do we, in your suggestion, how can we balance those issues? And in the same context, just a clear message. If this bill goes through, will we be able to reduce the prevalence of smoking? Or all we'll be able to achieve is to wipe out the legal cigarette market without reducing smoking? And how do we navigate around those issues? Because I'm just concerned about, we are Parliament. So even though we are committees, there has to be a point where we work together on impact. This is a bill that will have an impact on jobs. It's not directly a money bill. But what is your opinion on that? Because we've had others, this issue of handing the industry to illicit market without really impacting on the prevalence of smoking is an issue that concerns us. Where do we get information around that issue? And what are your opinions around that aspect? Because it's something that would need to be ventilated. And I would also, the other issues about the NEDLAC process, NEDLAC report, and the claims that are being made is a serious issue, but we'll deal with that as a committee. Thank you, Chair.
Thank you, Chairperson. Chairperson, I also would like to thank for this opportunity now, because this presentation has really cleared out my mind of all the confusions that I used to have. And Chairperson, what Honorable Member Sangula was saying, it is so correct, because he took the words out of my mouth. It's a huge concern when we say that NGOs are involved in this thing. For me, when you look at 2010, 2020, during the COVID time, there was a boom in illicit cigarettes. My daughter was prepared to pay 150 Rand a packet of cigarettes that usually cost 20, 30 Rand. And it didn't curb people from not smoking. People were even smoking more because the stress levels were more. And if you listen to that young man from the informal trade, I think it was last week or the previous week, he made it clear that all these small informal traders is going to lose business because of this bill. And I just need to understand exactly, if we say we implement this bill, what is going to be the impact on our economy? Already now, the illicit trade is taking money from SARS, taking money from people that it's supposed to contribute to this country. Chairperson, I have a huge concern, like my previous speakers were saying, because if NEDLAC came here and they gave us a report that was not true, we need to inspect that report, because we cannot, for the first time we are hearing now, things have changed. The first time we are hearing it's an international bill that is coming to South Africa. How come we can't have our own bill that is coming from South Africa? That is why I was asking myself, what is the reason that all these international companies from Canada, Japan, all these countries are in our bill? What is the reason? Because now you can see it, because it's an international bill, because that's why all the international companies are here. Sorry?
Continue, Honorable Mare, continue. Someone
Okay.
Was logging in, I suppose, and they did not mute. Thanks.
Okay. So Chairperson, this is a huge concern for me also. Because we cannot be a country on our own and then we implement another country's bill. We don't even know what is really going on, and where the NGOs are having more say than what we as Parliament say. And if you listen to what this Mr. van der Merwe was saying, is that the minister will have the right with his 15 people, but we don't know who the 15 people is. So take the responsibility of members of Parliament to do oversight. It takes it completely away. Chair, today I want to say this bill has made things very clear. This presentation made it very clear, because I still say what Member Mklape was saying, is that, is it going to reduce people from smoking? It is not going to do it. People are going to get ways, because the more you introduce things, more red tape you put it in, like when you put an alarm in your home. The person outside that wants to come inside, he's going to find ways to come inside. The more sophisticated the technology becomes, the more sophisticated the tax is becoming. So there's no ways that we can say, yeah, you are worried about the health issue. Yes, it is the health issues, but it is also our role to make sure that this law is being passed properly. And we cannot just say that, SAPS must do their work. We also have a responsibility to make sure that things are proper and it's safe. So, Chairperson, I also want to go to the previous speakers. The illicit trade is booming. People are still smoking. But what is our role as Parliament to make sure that this bill is passed, but it's passed so that everyone is satisfied with what is happening? And I want to say thank you to Mr. van der Merwe for opening and having a frank discussion of what is really going on, because I am quite clear of what is happening now. So, Chairperson, I have the huge concern of everything that was just said now by the previous speakers, the two previous speakers. I just want to stop there. Thank you, Chairperson.
Is it Kwego's turn now, Chair? I think so, if there's no one. Let me greet everyone in the platform. More so the one who are visitors. The presenter, I'm starting with you. But the disclaimer that I will start with is that when someone says that does not make sense, that is not enough to me. When we are busy entertaining this bill, when the bill was introduced by the department, if someone is intending to say it does not make sense to him or her, not just say this does not make sense, because to me, it does make sense. I just wanted to say that. Also, Chair, can I remind the presenter that the minister does have powers already. The existing act does provide the minister with powers. That it will always be the case. The power to regulate will always be in the minister's office. Is the prerogative of the minister to regulate. I also wanted to bring that to the meeting. The member that suggested that there are issues that we need to discuss as a committee when we don't have outside people. I support that one. I just want to remind the meeting that South Africa is a member to the World Health Organization. It means standards will be set there at the World Health Organization by the World Health Organization. Then the members that are signatories to member states will comply with those standards that are set there, health standards in particular. Chair, I also want to remind the presenter that there is another judgment that he did not cite, the judgment by the Pretoria High Court regarding tobacco legislation. There is that judgment also. I think I wanted to remind him about that. The other thing that I want to bring regarding his presentation is that if the consumption of tobacco and related products goes down, it means the introduction of this bill is for a good cause. Why I say so? Reduction in use and quitting are at the center of this bill. In the same vein, I understand the interest of the industry and that of the department. They have different interests regarding the matter. The other one is interested in profits. The other one has an interest in protecting public health, which is their mandate. That is the department. So those are different mandates. It's unfortunate that sometimes we forget what the public has said to us. We are also advised by the members of the public. They had a say to say they welcome the introduction of the bill because it protects also them. It protects the smokers and also the second-hand smokers. This regulation will help those. It's good, Chair, that we have been made aware by the presenters that this issue of illicit trading has a negative impact on the economy of the country. It's good that it has been brought to us. Though we are not an implementing agent, but we also have a concern around that. Some products that are sold in that space have not been tested. And we are losing on taxes regarding that. As members of this Committee on Health, we are members of Parliament. When reports are discussed and passed by parliaments, it's us to support those leading departments and security agencies in Parliament. The department should be providing them with statistics also. It means we are a partner, though we are not an implementing agent, but it's a concern. It's good that presenters have made us aware about this. There's also what I sense that some of the members that you represent here, the presenter now, are also involved in the illicit trading. They are beneficiaries in that because these cheap products are also sold in their businesses. Two wrongs do not make a right. I believe in that. So we must fight the illicit trading as a country so that we don't lose our jobs, we get the taxes, and we benefit out of our own products. I think they need to have statistics on the impact of job losses. How many jobs were lost? Not job opportunities, but direct jobs. How many were lost out of this illicit trading? So that when we debate this, we also add facts, and the facts, some will be getting from them. Chair, I wanted to raise those things, but it's important to note or highlight that the purpose of the bill is not to ban. The word ban is not there. The word ban is totally not there. It's not the purpose of the bill to ban tobacco in South Africa. We are just, the department has just, through this bill, introduced regulations against tobacco and related products. I think let me stop there, Chair. Thank you very much.
After Honorable Mutubatse, I've received a request from Honorable Shabangu. Is there now a slot for Honorable Mutubatse?
No, thanks very much, Chair, and thanks for the presentation. You came out very strong in your preamble to say that the bill is flawed. I would be very interested for you to go into depth, take me through as to which areas of the bill is flawed. And you further go and say that if in your statement, if you were given a chance, we wouldn't be where we are today. Now, what makes you to think that your views are superior than other people who are participants in making contributions to this bill? And to follow through on what Honorable Kleko has said, what is your role? What are you playing? What role are you playing to curb illicit trading? And why do you think that your members are not active participants in the distribution of illicit trading? What measures are there to make us to sleep at night to say you are playing a positive role in combating illicit trading? If you have evidence to that, I think I'll be very, very happy to get that. And you indicated that the network report was changed, can you follow due processes of the law, either open a case and write an affidavit because you say you have evidence that you can present that that was done? Can you, if you have that evidence, also approach relevant institutions, get an affidavit and say, this is what has happened in that respect, so that we can be able to follow through to what you are alleging. And how do you arrive at the conclusion that every informal trader sells illicit cigarette? Honorable Zungula clearly illustrates that the majority of the people who are involved in the townships in trading are the disadvantaged. And historically, those people are black. And if you are going to make this statement, I take this statement to be very serious, because what you are saying that every African or every black person is a potential criminal. That's what I understand from what you are saying. And I find it to be very offensive to arrive at that conclusion, to say that people who are in the informal settlements, who are trying to make a living, are in fact, you are criminalizing them, even if these people are trying to make a good living. Please help me in that regard. And help me also to say what is it that you can bring in the table to help? Because this bill is not the intention of this bill to ban, and it was never intended to ban, but its intention is to regulate, because there are new things that came into place. We need to regulate, and that needs to happen because we need to have the lives of both the passive and the active smokers being alive. Now, help me with those few questions. Thank you very much.
Are you there, Honorable Shabangu?
Thank you, Chair. Yes, I'm sorry for the noise. My car is on. I'm trying to charge. I don't have electricity. And thank you for the slot that you gave to me, Chair. I think my colleagues, all the honorables that spoke before me, they covered me. I just wanted to register my disappointment. I was listening when Francois started presenting, and I remember that Francois attended all the hearings, public hearings that we did in this term. And if one, to take where Honorable Mtubatsi left, he says the bill is embarrassing, but it does not explain why is he. I don't know whether it's a lack of English word to actually say what is he thinking about the bill, because it's just, when he started, he said it's embarrassing. Two, I'm very disappointed because the whole presentation, Mr. Francois is just saying that the bill is here to ban, it's here to ban. And as I'm saying that, he attended all the public hearings that we did in this term. And we were emphasizing the point of not banning. With new products that are in the market, we cannot keep on amending. We have to put everything together. It's just that what we are doing in this bill, but to say we are banning. And it's again, throughout the presentation, is talking about illicit trade. I think, Mr. Francois, you must acknowledge that the reason why we are here, why this bill, maybe go back to the research, look at the impact of cigarette smoking, the number of deaths, then you cannot compare life and profit. Yes, we want economy to grow, but it's not only cigarette that can be prioritized and then the people are dying. Secondly, as we are emphasizing the point that we are not here, this bill is not here to ban. A lot of young people, they get inducted to smoking. There's these vapors that we are full of flavors, is attracting young people, and they still have nicotine. So the bill is here to try and protect the secondary smokers to be safe. And secondly, to try and reduce the number of young people to be inducted in smoking. But how the presentation, I was listening attentively because you said you are here to help us. But unfortunately, I don't think this presentation it was helping for me because it was distorting the intention of this bill. You came up with your own narrative. It's saying we are here to ban, and I don't think it's you correct. And again, Honorable Chair, I think also we must not buy into the narrative of this bill was taken from the NGOs and from outside. Maybe we also need to go through that. But let me leave that since other members suggested a meeting, because we might also start distorting the bill following the information that is not correct. Otherwise, I'm covered by Honorable Teko and Mtubatsi. Thank you so much, Chair, for the opportunity.
Thank you very much, honorable members. Mr. van der Merwe, just to add on, we note your comments on the NEDLAC report, but just to mention that we do have officially a NEDLAC report that was presented by those who are given the powers to bring the NEDLAC report to the committee. If you have issues that were not resolved there, they would not come to us in this way that they've come in there. If there are issues of NEDLAC that needs to be resolved by yourself, please do that. They could probably have assisted you to understand to their members who they bring, who they don't bring into a discussion. So whether there was an NGO invited, there's been a clarity on that point. If there's still issues, at least this committee has been clarified. If there are still issues with regard to that, you go back to your partners in NEDLAC and then clarify that part. Because we do have officially a report from NEDLAC brought in by the right people who are actually mandated to do so. This bill is actually coming in to improve on the gaps that are there on the Tobacco Act that we have in the country. At the time that Act was brought in initially as a bill to Parliament in the 90s, Mr. van der Merwe, I was not a member of Parliament then, but I can actually remember very well when one was following that you made presentations there. You have been long in this industry, and that's why you were able to assist the department also during that space and time. If I could remember something that was very alarming that you presented that day again, was that this bill has been drafted outside the borders of our country. And that bill saw itself through as an act. So some other people may not be surprised when you are coming up again and saying this bill, this time around too, has not been drafted by South Africans, assisted by whoever that they could pick and choose as experts. Because that one, you could not have won in court on the basis that is a product coming in from outside the borders of our country. I don't know why we are allergic to people actually getting some assistance, even including internationally, because there's a concept one has learned that we are leapfrogging. You can't go like a frog when you can leapfrog and jump over and learn and take lessons of other people who are much more advanced than yourself on any other issue that you are doing and dealing with it. Therefore, that concept of leapfrogging is not something unscientific that most people do. You actually jump ahead of and don't do all the steps that every other person, because they educate you, they assist you to understand, don't do this, it was a mistake to do this, jump further. Where I would probably want to also tweak with you is the issue of illicit trade. And the department continuously, one has always been reminding them that if we are not really going to say, no, we're not part of this illicit trade, SARS will deal with it, police, and it's going to weaken this product at the end, because we must be seen to be putting our hands on this matter ourselves as health and department to really make sure we do encourage those who are powered to deal with illicit trading and then for improve on that one. But there's also information since we met Mr. Van der Merwe that some of the people who actually are legal companies are known in the country that they do illicit trade by night. During COVID, the borders of this country were closed, but there was illicit trading and illicit cigarettes that came up, because if I'm close to sell it legally, why don't I manufacture it illegally? So it can't be that we do not dissect that on its own to say there is a person who is a legal cigarette manufacturer or a merchandiser during the day and can choose at night to be an illegal one. The very same person or same company. So that also must be dealt with in terms of going forward. So the bill having been presented to us, I would want you to find comfort in that this bill is a product that was brought to this portfolio committee by a department via NETLEC and all that, and maybe through the assistance that some of you are bringing in here, this portfolio committee might refine and amend this product and get a final product. That's the reason why we are listening to yourselves. And the attitude of saying, get this bill refined here and there, we suggest this and that, will be acceptable. And I was making a presentation, Mr. Van der Merwe. You were there. I never, and actually, there are two bans that we have. You ban displaying on the point of sale, and you ban vending machines. All others, I'm glad you are saying so. You are thinking it is going too far. You say it is almost close to prohibition. So we might probably then agree that we have different views on any matter how it is. But I can still remember presenting to you more than 10 times, I said it is two bans. All others are improving and actually pushing ways around. I mean, so I thought maybe by the time we interact with you, we might find you having been able to assist and refine your input based on our interactions with you. But to take us back to a situation where you think that bill must go back and start from scratch, you are well aware there are people in the industry who are saying, please regulate us. We are vaping, we are selling vapes, but we are not regulated. And we reached that. So this bill is among other things bringing everything under one basket, all these products under one basket, and we want to quickly regulate. So you will not have luxury of time to take this bill back. Rather, you must say, please differentiate within this bill as to what are you going to do on non-combustible, combustible vapes, so cigarette pouches, and all that. And we should be welcomed maybe in the discussion. Please respond, Mr. Van der Merwe, on our content. Unfortunately, we'll only give you 30 minutes as a response. So at 5:20, we will have to stop after 30 minutes. Thank you very much.
Chair, thank you. Can you hear me, Chair?
You can. Thank you very much. Yeah.
Thank you, Chair, for the honourable members, the questions and the comments. It was a lively session, and I appreciate that because, as I said, I'm really serious about this, and I do think we have one last chance. Chair, it's impossible in 30 minutes to respond to all these questions. I'll try and group certain things. Chair, and you know, you made some very good comments in my view. We know each other, and we are, in my view, working towards the same goal. I want to say, Chair, that there is no tension between, or there should be no tension between profits or business and public health. I've said that outright in my first slide. You can go and have a look. We support your efforts to achieve a successful health agenda, and that means only one thing, that is to reduce the consumption of cigarettes, which is the most harmful tobacco product out there. There is no tension between profit and public health. If no businesses make profit, Chair, there will be no economy, there will be no jobs, there will be no taxes. So let's put that one in bed. Businesses are in business to make profits, employ people, invest in factories, and that's the only way that our country can grow. Public health is very important, but we have to see the whole picture, Chair, and I say this from where I sit. Tobacco control should not be seen in silos. It's not the health department here, and then law enforcement here, and then business here, and then society here, and then the informal sector here. All of these should be combined, and all of us, as I mentioned now, should form a team against those who do not comply with the laws of our country. And that gave birth to an illicit market, which is 60 to 70%. If the illicit market grows further, all the others lose. And me and you, Chair, on the losing side. Business is losing, the taxman is losing, jobs are being lost, our country gets a bad name, legal companies go down or they disinvest from our country. It's a lose-lose-lose situation. So may I respectfully say, Chair, that tobacco control cannot happen overnight. You cannot drive excessive regulation or make excessive, prohibitive, extremist measures and think that will reduce consumption. Because a bill is only as good as its enforcement is. And Chair, I tried really to mention a few things in the current act which is not enforced and which is leading to illicit trade. Now we come with a bill which is 10 times more restrictive. If you don't want to use the word ban then, 10 times more restrictive. How on earth will we get compliance? And that's why I say, Chair, the department needs to play a much bigger role in tobacco control. They need to involve and play a coordinating role, and that's what I also said in my presentation with this Tobacco Monitoring Committee. Make that committee a committee that can work. Make it a committee that is accountable to Parliament, which got the necessary expertise and which can help the Minister to reduce consumption. So there's no tension, Chair. We are all on the same side of the fence. We are all against the illicit operators. Let me make that very clear. The other problem, Chair, is that the world is moving on. Industries are evolving. Tobacco harm reduction is a concept that's come into the last couple of years. The industry is innovating. The scientists, and I'm not a scientist, say that it's a less harmful product, and the quit or die approach is not working. And that's what we are trying to do. We are trying to say to smokers, if you don't quit, you're going to die. But we have to involve the tobacco harm reduction concept in this bill, Chair. And I respect the comment you make that you can refine the bill, and that was one of my options. I said send it back or lead from your side as a committee with refinements, with amendments, with changes from everything that you've heard from everywhere. You're going to have to instruct differentiation between products, to have a transition of smokers from dangerous products to less dangerous products. Nobody ever said it's harmless, but we have to understand the reality of the tobacco market and that reduction in consumption is not going to happen overnight. In the meantime, while consumption is coming down, you at least want the market to be compliant. By manufacturers, you comply with all rules and laws. Not only manufacturers, processors and farmers also all need to comply with the rules and regulations so that at least that 11 million smokers who have the right to choose the product use a legal product, which is expensive, which complies with the highest standards and the laws of our land. And that is the basket I want to see for tobacco control. A bill, as a restrictive bill, is not going to reduce consumption overnight. We want the department, and we said this at NEDLAC, Chair, we want the department to play a much bigger coordinating role to coordinate law enforcement, get SARS involved, get the police involved, get the DTI involved, Get the legal people involved, get the scientists involved, because only then will you achieve a reduction in consumption, Chair. I want to say, lastly, Chair, I hear what you say about NEDLAC, and I respect that. All I want to say, please, may I ask the Honourable Committee to go and read the document that we've submitted with the NEDLAC report. Because, as I said before, we did not want to sign that NEDLAC report, and it's not NEDLAC that changed the report, Chair. Let me make it very clear. It's government that changed the report. Unfortunately, NEDLAC allowed them to change the report. And that's why I used the saying that government became the referee and the player and the linesman at the same time. We did object. We refused to sign. That report should have been signed a couple of weeks before it was actually signed, because we refused. We raised the concern that we're not happy with these changes that are made. But we were told, that's it. Now, and then eventually we agreed that we will sign the report on condition that we can submit our concerns. So we don't have time now, Chair, but it's a 3-page document. It should be in your pack that NEDLAC submitted to you, as you rightly said. And there we raise our concerns around the involvement of NGOs, and we exactly stipulate, there's no guessing here, Chair, we exactly stipulate the paragraphs in the NEDLAC report where things have been changed, which were not discussed during the deliberations. On page 3 of our reservations report, there's about 10 or 12 bullets where we say exactly, we refer to the paragraph in the NEDLAC report where the content has been changed. So this is no thumb-sucking, Chair, and I implore with you to go and read our reservations document, which includes the involvement of the NGOs. Let's make this comment about the NGOs, Chair. That's why I say, if we were in that room with the South African Department of Health, I am sure would have made more progress, because South Africans have a better understanding of these things. We must understand how the NGOs work. It's international organizations. These NGOs are well-funded, well-resourced over the world, and they have one mandate, and that is to drive excessive tobacco regulation across the world. And it's the same template. It's plain packaging, it's display ban, it's public place smoking bans, etc., etc., etc. And that's why I say, for some of the honourable members asked the questions, what would we change in the bill? The honourable clerk asked the question. Look at I ask you respectfully, look at the NEDLAC documentation. We have actually had a marked up bill where we try to help the department in the NEDLAC process and say, on these we made alternative proposals. I can give you one example. We were willing to negotiate on plain packaging, for example, because we believe plain packaging comes from an international template which is not fit for purpose in South Africa, as long as you have a 70% market, illicit market. If your playing field is level, Chair, if you have a 10% illicit market, different story, then you can give plain packaging a try. All I'm trying to say is, don't do the wrong things which come from international templates in a market where you have 70% illicit. And I've spelled out what will happen with plain packaging, with counterfeiting and all those things. And to Dr. Leroux's question, it's much more difficult, Honourable Leroux, to fake a brand as it is than it is to fake a plain packaging, because with plain packaging, the brand elements are removed. The way plain packaging is the government provides the pictures and the graphics that must go onto a packet, and that's the same for all packets. And the only thing that you can do, the manufacturer, is to write in small font, the same font, on top of a pack, it's a Stuyvesant, or it's a Daniel, or it's a Camel, or whatever. So that's much easier to counterfeit. To counterfeit a real brand, Honourable Leroux, is much more difficult. There are strong laws against it, and brand owners, if their brand is counterfeited, they throw everything behind that, because it reduces the reputation and the standing of their brand if it is counterfeited. So, Chair, again, onto that question, and we don't have time now, but on everything in this bill, we went the extra mile in NEDLAC. We made proposals on everything. We were, for example, on plain packaging, we said, okay, if you want to change the current health warnings, let's negotiate about it. We put something on the table. We actually went as far as to say to the department, okay, the industry will give you 40% of the pack, and maybe even 50% of the pack to put your health warnings, but leave the rest for the industry at least to have their brand elements and their hard-earned branding logos and trademarks and colors, distinguishing colors on those brands. So that's as far as we went, to meet each other halfway. The department's view is no, it's plain packaging, finish and clear. There's no negotiation here. We tried to negotiate, for the point was made by one of the honorable members about criminalizing the informal sector. The bill will criminalize the informal sector, Chair, nothing else. And the only reason is because if you ban display, if you ban the sale of single sticks, you are going to criminalize businesses in the informal sector, because that's how they make their living, is by displaying their produce and by selling single sticks. It's driven by necessity. And if you want to ban that, it's in your hands, Chair. If you ban it, some of those businesses will go under. I can't answer you how many, but if 80% of cigarettes are sold in the informal sector, mostly by small businesses, and their business model is to display their merchandise, whatever that is, and they sell single sticks, you decide if you want to kill their businesses or not. It's the bill that will criminalize them, nobody else, Chair. So that's why I'm saying this is another international template to ban the display. How do you ban a display in a market like South Africa with our DNA, with the composition of our society, and with a huge role that the informal sector is playing? We heard what the CEO of Capitec said, how active the informal sector actually is. And it was actually an eye-opening, I think, because people are doing business. They're making a living. It's either making a living or going to stand in a queue to receive a grant. And we have to stimulate small business. We have to create business. And let me also answer that question, Chair. The small businesses are the victims of illicit trade. They don't drive illicit trade. They are the victims of illicit trade. The actual culprits of illicit trade are big corporates, not small backyard organizations, manufacturers who manufacture in the backyard garage. They are big corporates, and that is why it's actually easy to catch them and to wipe them out. The small traders are at the downside of the value chain. They have no choice but to sell illicit cigarettes because they are cheap. And if a small trader has a legal brand like Stuyvesant on their pack, it's costing 40 Rand a pack or 45 Rand a pack, or 2 Rand or 3 Rand a stick, and there's an illicit brand next to it which is selling for 50 cents a loose straw. If that small trader doesn't have illicit products on his shelf or on his display, he will not make a living. So the small traders, let's not...
Mr. van der Merwe, if I were to advise you, we have had those presentations by themselves. The hawkers came here. Just go through what you actually would be and not dwell on one point for so long. You won't be able to cover most of the things. You will not.
Okay, Chair, that's fine. I just want to put the perspective that the small traders are not the criminal ones. They are the victims of illicit trade. To come to the issue of illicit trade and the question that the Honourable Leroux asked. So if we talk round figures, consumption in South Africa is around 35 to 37 billion cigarettes. Only 13 billion, and now it's even less, of that is legal, tax paid. That means it leaves you 24 billion sticks around, which is not tax paid. And at the moment, excise on a cigarette is more than 1 Rand. So the calculation is easy. Government loses at least 24 billion. The minimum collectible tax as it's defined is the excise, which is announced by the Minister of Finance every year, which is 22 Rand 80 per pack of 20, plus the VAT on that takes you to 26 Rand 22. That is only the tax. And Honourable Leroux, the tax system in South Africa in cigarettes is a duty at source tax. It means that before a manufacturer shifts his product from his factory into the trade, he must declare that to SARS, and he must pay the excise up front and the VAT on the excise to SARS. He recovers it later from the consumer, the retailers and the wholesalers, and then obviously there are costs added. But the tax in itself is a duty at source tax. And that's why we say it's not difficult to tackle, because there are 13 or 15, you should ask SARS, local manufacturers licensed and registered by SARS. I represent the only legal local manufacturer There are also other legal manufacturers in South Africa who import products. They are the likes of Philip Morris International and Japan Tobacco International. They import all their products, so they don't have factories in South Africa, but they are 100% legal companies. I can just refer you, Chair, and if you want, I can share with you the latest Ipsos research, where Ipsos has broken down, and these are not my figures, has broken down the whole market into manufacturers and brands. And you will see that the manufacturer that I represent and the other twos, JTI and PMI, are 100% legal. You will see the other manufacturers mentioned by name in the Ipsos report that they sell 90%, 95%, even up to 100% of their products below the tax rates. So it's very simple to say that they are not paying tax, because how do you sell 90% of your products below the tax rates even? What about your costs and your profit? You can only do that if you avoid the taxes. And that is the picture around illicit trade, Chair. And that is the biggest reason why our health agenda is failing. And I did not say that this bill is an embarrassment. I said that our tobacco control is an embarrassment, Chair. And I say that with conviction, because instead of reduced consumption, we have increased consumption. That is a failing health control environment. And we are here to try and help you to refine a bill which is not too extreme, which can be enforced, and which over time can reduce the consumption of cigarettes, but which can also bring in new generation products, the risk continuum of the different differentiation of different products based on the risk continuum. Get the scientists in, let them tell you, I'm not a scientist. And in that way, have the department coordinate better between various states, arms of government, and then we will see a successful tobacco control. And stop working in silos. Chair, we are absolutely committed to work with you, because it's also not in our interest if illicit is getting bigger and bigger and bigger and the legal industry is going down. There was a question around how many jobs. Oxford Economics measured this jobs, 36,000 jobs lost in the legal value chain since COVID. So I also said, Chair, from COVID to now, the legal industry has shrunk by over 40%. That means jobs, that means taxes, that means investment, that means farmers and farm workers losing their livelihoods while consumption is on the increase. You see, so there's no winners if you fail with your tobacco control, because consumption goes up, the legal industry goes down, your fiscus loses money, and we are all losers. The only winners are criminals. Let me see, Chair. I tried to group a couple of things. Let me see. Yeah, a parliamentary oversight, Chair. It's because we have so much respect for the institution that, yes, we understand the minister has got powers. But, Chair, we are in such a deep drift as far as our tobacco control is concerned. We are failing. We have failed. We have one opportunity to turn it around, and that's in your hands. And that's why we ask you, Chair, we plead with you as a committee, take this process by the scruff of its neck. Ensure that you make amendments to this bill which is enforceable. Not with international things that cannot work in South Africa. Maybe later it can work. And insist that Parliament wants to have a look at this thing and walk the road with all of us to ensure that this thing is work. Make the department and this monitoring committee accountable to Parliament. Let them report to you quarterly or 6 monthly. How's it going? How's the enforcement going? How's the new bill going? Do you measure, commission studies to see on an annual basis? At the moment, government is not commissioning studies. The socio-economic impact assessment, Chair, which I also refer to, was done on a 2018 version of the bill. That bill had more than 300 amendments to the bill that's currently in front of you. No socioeconomic impact assessment. If there was a proper, independent, third-party socioeconomic impact assessment done, all of these questions that you asked to me would have been answered by the socioeconomic impact assessment. We've heard previously that the department made the comment that this bill will have no financial implication for the state. Okay, you cannot be further from the truth, because this bill will have a massive cost to the state if you want to make it work, because a bill without enforcement is worth nothing. And there needs to be resources from all law enforcement agencies, in our view, coordinated by the Department of Health, so that you have a whole of government approach when it comes to tobacco. And that's my respectful submission, Chair, that it must be a whole of government approach to tobacco control. Otherwise, we are going to fail again. So
Yes.
I'm just trying to see all these questions. Chair, I tried to brief them. Yeah, I spoke about the NGOs, I spoke about jobs, taxes, law enforcement agencies, the illicit trade, the pricing, the taxes, the socioeconomic impact assessment. Yeah, I plead with the committee to go through the documents, the NEDLAC documents, firstly, to see that the proposals we made are there. They were all rejected. And to our reservations document, and that's the only condition that we would have signed the NEDLAC report on, because of the changes made at the end of the NEDLAC report, which we were not happy with, and hence the birth of our reservations document. It's all outlined there. We don't have time to go through it now, but we were very specific in outlining that, because I can't stand in front of you as a committee and say, well, this and this and that. There, it's on paper, Chair. It's there for the record. The model, the alternative bill, the alternative proposals are all in the NEDLAC documentation. So I think I've responded to that as well. Lastly, Chair, I know time is of the essence, but let me recommit myself and the legal industry to this cause. And I say it on record. I say it in public, Chair, because we are really concerned about our tobacco control environment, that we don't throw the kid out with the bathwater. And we are here to help you, Chair. We are here to assist you. We don't know everything, but if we put all the little bits together, I'm sure we can help you as a committee to panel beat this bill, amend this bill, and get something in the end that can work and which can reduce consumption and allow for new generation products and tobacco harm reduction also to come in. And it must be regulated, because there is no regulation on the new generation products. So it's absolutely, you're correct. It must be regulated, but not the same as tobacco products. Otherwise, you don't create an opportunity for transition. Thank you, Chair.
Thank you very much. We wish you could have regulated as of yesterday. You are right. I'm glad now that our discussion with you is to say, let's work together. Don't throw everything out. Let us amend if we can. Let us improve on this product and go forward. We will, if there are issues that you still want to send to us, please, the address of Ms. Machalamba, email address, please forward that to us. We as a committee are going to be collectively getting all those inputs and really looking into them. You also are free to bring in share with us those unhappiness comments that you derive from NEDLAC. But do know that there's no expectation that NEDLAC, the three partners there, should have agreed on every point. There may be areas of disagreement. It's for us as a committee to look into that with the national bigger picture on that. But thanks, Mr. Van der Merwe. We have been meeting with you quite often, and your contribution would be actually considered in the final decision-making processes. Have a good day. Thanks.
Thank you, Chair. Thank you very much. And call me anytime. Let's sit around the table and work this out when we can. Thank you for your kind words. Thank you for the opportunity, and good luck with your huge responsibility, Chair. Thank you.
Okay, thank you. And colleagues, we should give each other 3 minutes break to get to the bathroom back with a cup of coffee or tea, water, and then let's start with about not exactly at 5:45, but just 2 minutes after that. Okay, 12 minutes to 6 we start, not 15, 12. Thank you. But Ms. Machalamba, so long, can you give the last presenter the link, and then they could then become co-hosts, so that when we come, we look at their presentation and then they start. Thank you. Okay. Honorable members, I suggest that we start. I have not seen whether the link of the other alliance. Okay, we welcome the new alliance. We have just finished another alliance. You are going to tell us you are not another alliance from some issues about tobacco. Is Dr. Letape on the platform?
Yes, I am, Chair. Just wanted to make a declaration that I am a co-founder of the organization that is going to present. So I will not be asking any questions. And if necessary, I can even excuse myself from the presentation. Thank you, Chair.
No,
That's
thank
just
you
my
very much.
declaration.
Thank you very much. Honorable members, Dr. Letape did raise with me that before the third presentation today, we would like to make an opening statement, which he has done. And I was then going to suggest that we do allow him to be on the background. But we then ask him not to participate in terms of questions. Unless there is a strong view that he should not be here again, or which I would not be able to understand. He has made a declaration that I'm going to listen just like all of us, but I'm not going to engage with the presentation either or. Okay. Will that be acceptable to honorable members? My feeling is that let's allow him to be part of our meeting. And thanks that he has come in to declare, for example, he may not have declared. And then we agree that he will not engage with the presentation. Agreed, honorable members?
Yes, Chair, I support your view.
Okay, thank you. Any opposite view? None. Okay. Alliance of partner to Dr. Letape. You do have 30 minutes now at 10 to 6. We will give you up to, what time is it? Up to 20 past 6. Thereafter, all the members will interact with your presentation. You will take a pen and paper and come back again to support us with responses on the presentation. Introduce yourself and the team that is with you and start the presentation. Thank you very much.
Thank you, Chair, for the privilege to address the Portfolio Committee and good best wishes for your deliberations. I've spoken to Viyukazi that I'm prepared not to show slides to save time because I was party to some of the questions asked by the Portfolio Committee in previous sessions. And these are excellent questions, and I'd much rather shorten my initial remarks so that there's more time for questions and response. With your permission.
Go ahead, sir. Thank you very much.
Thank you. So just to provide a bit of context, I'm a specialist physician, born, bred, trained in South Africa, and I've worked and treated thousands of patients and have been a particular vocal tobacco control and advocate, anti-tobacco advocate all my life and all my career. And it's because of that background that along with Dr. Etlapi and several of us, we started the Africa Harm Reduction Alliance, which works not only in tobacco control, but also harm reduction in alcohol, drugs, HIV, and basically works for better access to harm reduction methods for our fellow South Africans. I would also want to highlight the fact that South Africa and your government has been a world champion in a few fields. One has been a drive for human rights, but another has been for harm reduction. If you look at the HIV/AIDS epidemic, and you might recall that South Africa was the epicenter of that epidemic, it was through the work of the Nelson Mandela Foundation, who eventually helped to bring access to antiretroviral therapy to so many of the HIV patients who were denied access. So our country can be proud of its history in harm in harm reduction and the upholding of human rights. The Africa Harm Reduction Alliance, I just want to be very clear, is not funded by the industry, has never been funded by the industry, but we engage with them to try and basically work for a cigarette-free world. And we've always upheld the WHO's Framework Convention on Tobacco Control as the framework that we 100% agree with, and that we also agree with the United Nations high-level meeting political statement on the prevention of non-communicable disease, which states that we should be working for a whole of society, whole of government approach to keep these diseases under bay. Now, the reason why we wanted to present is to argue that the current bill in its present state, there's a hole in the soul of this bill. We so fully agree with so many of your members in the Portfolio Committee that the intention, the motive of the bill is to protect South Africans, to make sure that smoking is pushed down, to protect especially children. So there's we have in full consensus that that's the motive of the bill. But the flaw in the bill at the moment is that it doesn't, in its essence, recognize harm reduction and apply it to tobacco harm reduction and make it possible for those smokers who are not willing or are unable to quit to find fire escapes to their habit. Now, as a physician, I was, and this is mea culpa, I was completely on board the quit or die approach to smoking cessation and advised most of my patients that if you don't stop, eventually you will quit. You will be dying of smoking-related disease. And we know that the evidence shows that 1 out of 2 people who smoke will die prematurely because of that. So the Africa Harm Reduction Alliance is specifically there to argue for the recognition firstly, and then the implementation of harm reduction principles in the bill. Currently, the bill is still, unfortunately, liable to be seen as an equivalence between combustible tobacco and then the new generation of smokeless, reduced gram products that deliver nicotine in a different way. And we feel that it is important that the consumers in South Africa and also the patients already have smoking-related disease, that they should have access to affordable smokeless products so that they can thereby reduce their risk of disease, smoking-related disease, smoking-related disability, and live a full and high-quality life. Now, just moving on to where we are, the current state of tobacco control, and I've been involved in tobacco control for the last 3 decades. Many of us in the Alliance have been decades-long champions for tobacco control. Where are we now and where is the desired state? So currently in the world, we have 8 billion people, of which 1.4 billion people smoke. We know WHO's confirmed statistics that 8 million smokers per year die. Now, just as a short aside and for context, the total number of people who died during COVID was between 2 and 3 million. And yet 8 million people a year die because of this epidemic. In South Africa, we have 9 million people who smoke, about a 20% smoking prevalence, 20% of adults smoke. And we have 40,000 people who die per year because of smoking-related disease, out of the 63 million people in South Africa. So what is the desired state? We'd like to live in a world, and that's what we're working for at ARA. We'd like to work in a world where there are less than 5% smoking prevalence, because we know that it is unlikely that all people on earth who smoke cigarettes today in 10, 20, or 30 years from now will stop smoking altogether. So we call the end game for tobacco control is to have less than 5% smoking. South Africa, it's 20%. In other countries like Sweden, they've actually reached the goal, where it's 5%. We would also like to see a world where there is proper regulation to facilitate a decrease in smoking-related disease, smoking-related disability, because people who smoke get lung conditions, they don't have the vital capacity to continue with normal work, and eventually they become passengers. which normally has to be carried by the state. So less disability, less premature death. Obviously, if you have less disease, there'll be less cost. The cost burden on the healthcare system will be decreased. And then hopefully there'll also be less illicit trade. So to get from the current state to the desired state, what are the obstacles and how can the bill help to get us to the desired state in South Africa? Number one is just the recognition of harm reduction. That's our raison d'etre. That's what we are working for. And we believe that the current bill, unfortunately, facilitates or mitigates the potential benefits of tobacco harm reduction. There is a big emphasis on protection of youth, which we absolutely agree with. But within reason that you don't want to put the adults who smoke at a disadvantage and not make it possible for them to have access to harm-reduced products. Then there's the whole question of industry. We don't speak for the industry. What we would like the industry to do is to stop selling cigarettes, to have eventually a cigarette-free society. But as some of your previous presenters have said, there's a huge metamorphosis happening within the tobacco and nicotine industry where there are some innovations that provide less harmful deliveries of nicotine to people who smoke and that make it possible for harm and cost to be reduced. Another obstacle I won't go to at all, but was the whole question of illicit trade. For us, the big issue on illicit trade is this bill could be a centerpiece and another example of South African leadership in harm reduction and human rights. But if it's only for 30% of people who smoke cigarettes in South Africa, we'll be missing the point. So we are hoping that we can overcome these obstacles and then reach the desired state by using tobacco harm reduction as an additional means. And I just want to make that very clear. ARA is completely aligned with WHO's Framework Convention on Tobacco Control and believes that that's the centerpiece of how we can manage and cut down the tobacco epidemic. But what we would like to have is an addition of harm reduction to tobacco control, which will provide the optimal conditions for people who smoke if they can't smoke, to then switch to a less harmful product. Now, if you look at the Framework Convention on Tobacco Control, and several of your members in the previous sessions have mentioned WHO, the Framework Convention under Article 1D very clearly states that tobacco control includes harm reduction methods. But what has happened up to now with the FCTC is it has never elaborated on what that means. So in tobacco, if harm reduction methods were to be applied, it would be very much the same as what we do with motor vehicle accidents, where we use seat belts, or motorcycle accidents where we make it obligatory through law, through regulation, that people should wear helmets. In drugs, the facilities in Gauteng and other parts of South Africa where a needle exchange programs are in place. The best example is, for instance, antiretroviral therapy, which we use during HIV/AIDS. What did those therapies do is they simply reduced the severity of the infection of HIV/AIDS and provided the sufferers of HIV to lead almost normal lives. COVID is our last example where the COVID vaccine could be seen as a harm reduction agent. It was fully endorsed by the South African government, fully endorsed by WHO and worldwide, and that perhaps helped to reduce the number of fatalities of COVID over the COVID epidemic period to about 2 million. But I would again just remind you that every year the clock is ticking and we are losing 8 million people who smoke prematurely. So what would ARA ask of this committee in addressing the bill? If there is a hole in the soul in this bill, and that hole can be filled with evidence-based sound harm reduction, our first request would be that the bill facilitates for risk proportionate regulation. At the moment, the bill does not distinguish adequately between combustible tobacco and non-combustible smokeless nicotine delivery systems. There are basically three categories at the moment. The most prominent one in Africa and low and middle income countries is oral nicotine pouches, which is not inhaled, and would probably become the most accessible product for people who smoke in Africa who wish to switch and quit smoking. The second category are the e-cigarettes, or electronic nicotine delivery systems, as we call it in public health. And the third is the so-called heated tobacco products, where tobacco is not combusted or set alight, but it is heated and then inhaled. And then there are a range of oral tobacco products which are used in different parts of the world and not as particularly applicable to our scenario in South Africa, except for snuff. But we think of snoofs, which is the equivalent of the pouches in Sweden, which is a tobacco pouch. And then in several areas of Southeast Asia, there are different forms of tobacco or betel nut that they use in their mouth. So this bill would do the world a great service, and most particularly the consumers in South Africa, if it were to firstly recognize the principle of harm reduction. Secondly, make sure that there's a differentiation between combustible tobacco and the smokeless categories that I've just mentioned. And then to make sure that all of the regulatory challenges are overcome with sound evidence. So take for one labeling, just to make sure that the labeling of risk-reduced product like oral nicotine pouches does not have to carry the same sort of warning as combustible tobacco, because they are stratospheres apart. I think some of the previous speakers spoke about the risk continuum, and this is really important, is to have a comparative risk framework as opposed to an absolute risk framework. Secondly, on safety, several of your members rightly were calling for proper product standards and an evaluation of the ingredients of these new products, especially these new products. So there are other countries who have gone through the process, like Germany, the United Kingdom, and currently the South African Bureau of Standards are doing exactly the same for the categories of so-called tobacco harm-reduced products. And then also to address the issue of addiction versus dependence. Nicotine as delivered by cigarettes without any fear of doubt and with total consensus by all stakeholders, nicotine delivered by cigarettes is totally addictive and is rightly labeled as such. We warn our patients as such, and it should be regulated as such. But nicotine delivered as part of nicotine replacement therapy, which we use every day in medical practice, when we prescribe nicotine replacement therapy to our patients, or nicotine in oral nicotine pouches, the argument can be made that this is dependence forming without a doubt, but whether it's at the same level of addictiveness as nicotine in cigarettes is a different matter. And there definitely more research is needed, and WHO, as the premier technical agency in public health in the world, should really be taking a lead on that. And then lastly, the two other points that the bill has to address and addresses in part is the prevention of marketing to children, so the whole issue of youth access, and then taxes. We know that the most effective way to move people from a more harmful to a less harmful product is through taxes. And at the moment, if there's an equivalence in taxes between all these tobacco nicotine product categories, it will not lead to an incentive for people who smoke to actually move to a lower form of risk nicotine device. And unfortunately, a lot of that is also to do with the misperceptions. There's a misperception even amongst health professionals like physicians. Even in the United States, more than 60% of physicians believe that nicotine might be linked to cancer. Now, we know that this is an absolute falsehood. Nicotine is in the WHO list of essential medicines as part of nicotine replacement therapy. It has been evaluated by the International Agency of Research Against Cancer, and it is not on their list of potential carcinogens. But this kind of misperceptions make it very difficult for a consumer to know who to believe. And here, you as portfolio committee and the government can make a huge contribution. to make sure that evidence-based messaging is placed on these types of products. So the bill can make a huge contribution in South Africa, but I would also argue to other lower middle income countries where it can be used as a template to foster and to include harm reduction in tobacco control. The 4 countries, and in our submission, we've given you examples and reports and the right scientific evidence to back that up. The 4 countries where harm reduction has been successfully employed and incorporated in regulation is basically the United Kingdom, Sweden, New Zealand, Japan for heated tobacco. They are still banning electronic cigarettes, but for heated tobacco, they are world leaders. To give an example, in Japan over the last 6 years, 52% of their cigarette sales has been wiped out because the Japanese consumers have adopted, those who couldn't quit smoking switched to heated tobacco product. So just as a last nudge to the portfolio committee is we as the Africa Harm Reduction Alliance, we stand ready to provide you with the fit for purpose evidence that you need to debate and argue the case for or against what we see as the whole and the soul of the bill, which is harm reduction is missing. And we would want to make sure that we are in a position to get the South African consumers and patients to the desired state in tobacco control. And we actually wrote a report on this. We did a study. Derek Yach, who was part of the Medical Research Council and then a high position in WHO, and myself and a few other scientists, wrote a piece on how many lives could be saved if South Africa were to employ tobacco harm reduction methods in addition to tobacco control. And the figure that we came up with was about 320,000 lives could be saved up to 2060 if the South African government allowed for affordable, accessible, and acceptable tobacco harm reduction products for those smokers who cannot or will not quit smoking. We wish you really all of the best and just stand ready to come with the scientific angle of this debate. We cannot get too involved in all the illicit trade and all the commercial aspects of this. Our primary stakeholder group are our patients, the consumers of South Africa, and to make sure that we come with a solution that can both curb tobacco and make cigarettes history, but at the same time help those 9 million people who smoke in South Africa today to, if they can't stop, to switch to something less harmful. I thank you very much for the privilege to address you, and really looking forward to questions.
Thank you very much for your input, physician, and knowledgeable on these aspects. Honorable members, may I recognize hands that are coming through? God, I see Dr. Leroux, number 1. Honorable Van Staden, number 2. And then Honorable Clark, you are number 3. Let me just page through the other way. I can't see them here. Gallery. Okay, honorable members, my gadget is failing me here. Whoever is then coming through, who else is there? Honorable Tubatse. Okay, let me start with Honorable Dr. Leroux, Van Staden, Honorable Clark. Who's number 4? My gadget is
Mr.
hiding.
Mutubatse, Chair.
Mutubatse is number 4. Help me, Miss Machalamba. With other hands.
There's no other hand, Chair.
Okay. If there's no other hand, I'm number 5. Okay, honorable members, start in that order.
Very much, Chair. Thank you very much for the presentation. Really some helpful food for thought. I just wanted to ask a few things, particularly on the harm reduction side of things. I think one of the things that continuously comes up is around the harms of nicotine. And so there's some people who say there are no harms at all, minor increases in blood pressure and pulse. There's some people who say that that nicotine in non-combustible products have the same or similar risks to smoking in terms of cardiovascular risk. I do completely recognize that the evidence for nicotine causing cancer is not there. So apart from the cancer aspect, just the cardiovascular risks. What evidence do you have in terms of reduced reduction of pure nicotine versus nicotine delivered in combustible products? Is there good evidence on that? And could you, if there is, please, would you give that to us? The second question was just around my understanding of your presentation is saying that we need to try and push people from the combustible products to the non-combustible newer products that are less harmful, and that will have a real significant benefit on the public health of our society. And obviously part of that is taxation, part of that is how we regulate it and the warnings we put on things, and part of it is about allowing clinicians to direct people in the direction of vaping, for example, rather than smoking, if we want to try and get people who are smoking to stop smoking. Now, one of I just wanted to get a sense of your understanding of, at the moment, there is currently, from what I understand, there was recently an excise tax put on vaping liquid, and would you and most vaping products, even the single-use products, are fairly expensive compared to smoking. What would you recommend if you had your way to do around that? What would you say would be a fair price for vaping products or not? And then I guess the other question then, of course, comes to the issue of single-use vapes, which we are concerned about as an easy access to the youth market, and and also the environmental impact of that. So would you recommend that we get rid of you don't use them, or how would you approach that? Because obviously if you don't have single-use vapes, then the access to people who are smoking, it makes it a much higher level of entry. So just wanted to get a sense from your perspective on that. And finally, I think that figure of 326,000 lives saved by 2060, I think, has to leave us all pause for thought. I would love to see that article if you are able to provide that to us. I think that's but that is certainly makes us realize in real numbers what the value of our input and a change of the law would be. So thank you for that, and yeah, I'd be very interested in hearing your
Thank you, Chairperson. Good evening, Dr. Heeman, and thank you for the presentation which you have provided us. I just have one question, and it is as follows. I was just wondering if you could tell us about the Swedish moral experience on nicotine and tobacco products. What has they done in terms of legislation to help the Swedish people smoke less, and to in order to bring forward a more healthy nation in Sweden? Thank you, Chair.
Thank you, Dr. Heeman, and thank you for your presentation. As much as we must note studies showing decreased health risk, we must note that the reduced risk is still a risk. While also noting reduced harm, who currently regulates the contents of e-liquids? Could you elaborate around that? And how would you suggest the content, ingredients of vapes be regulated? And what would you suggest as penalties for non-compliance? Do you have an opinion on adjusting legislation in some way for non-disposable and disposable vapes, for instance? And if so, how would you do that? And then thirdly, is your aim with vaping for people to stop smoking cigarettes or to stop smoking altogether eventually, including the use of vapes? Thank you.
No, thanks, Doctor. Thanks very much for the presentation. I think we learn new things every day. You argued that the harm reduction principle. I didn't hear you coming out clearly on which are those. If you can just elaborate on the harm reduction principles for my future engagement. And on them, we are regulating because banning has got far-reaching consequences. Are you advocating that initiation of those who are not, or those who have not, who are not in the world of smoking, can, if they are exposed, because young people, if they are exposed to new things, and the majority of the young people, I might be wrong, they are not exposed to these pouches. Would you encourage that instead of them going straight into tobacco, you'd recommend that they can be initiated through these other methods which are less harmful? Will that be the way to go if you were to recommend the route that must be taken in this bill? Thanks. Those are my two questions.
Was that the last one from us? There's no other one. Before you answer, Prof, hold on for mine. But you were muted there, but your mouth, you were moving in.
Yes.
Let me just add on my side, related to some of the colleagues that have asked, if one were to consider this issue of nicotine pouches, is there a way these countries are actually able to tell? First, let me just check the nicotine. Is the addiction on nicotine dose related? And maybe you would then advise to, of course, we are actually saying it's not carcinogenic. Well, let's accept the scientific view, but there are still some risks related to nicotine use. Maybe people would not like to see a less content of nicotine in their products because they will not go to this very idea of just being on high or whatever that it does to them. So is there a particular advice you could give to say, even if you are to allow nicotine pouches, but they should be at this level of the content of the percentage of this inside there? And then generally speaking, what then should we do with those who are probably advocating for vapes? And I'm glad some of them from the industry have said, maybe if you do allow vapes, don't go for this single use, because not only are they accessible to young people, but they are also having certain environmental impact challenges because of them not being disposed anyhow and all that too. And my last one is to say, if one were to get that on board, why would you not say people should then stay with those flavors that have always been there on cigarettes, with mint or menthol? Because one other presenter made a very unfortunate statement that said the government was actually wanting to promote the issues of condom use, and we listen to the young people to say, I would love a condom that is flavored vanilla and flavored this and that. So because that uptake, obviously, we were looking into appeasing the young people. Not all of us agreed with that. We were appeasing the young people. We're saying, if this condom is vanilla flavored, I'm likely to use it more than if it is not. So you want to encourage me to do it, do that. The last one from my side, you are saying the department has always had some approaches of harm reduction on any other issues. I want you to explain that a bit more, like you were bringing it on issues of HIV, to say, I'm thinking that says you don't throw people out and say, look, you are likely to have sex. That may be a problematic if you don't use a condom and you don't know the partner whether they're HIV positive. So you probably think that is part of harm reduction in terms of HIV spread. But what are other examples? Or maybe explain that further, because to me, I thought maybe listening to you, a South African who's also a physician, and have those lessons that are there already in the Department of Health, where the harm reduction processes have been used in other areas and other categories. Just share that with us. It will assist us in our understanding. Thanks.
Thank you so much, Chair. I just want to be, you can hear me? I was muted. Can I speak?
We can hear you well now. Thank you very
Okay,
much.
thank you, Chair. Well, let me just thank Honourable Member Leroux, Van Staden, Clark, Mushomi, and yourself. The first question I can perhaps just address, there were 3 questions about nicotine. And nicotine is really central to this discussion because the war on tobacco, and as I mentioned, myself and our medical association, we were very much part on the war on tobacco. But these days it's morphing into a morph on nicotine, which is probably a misplaced commitment because nicotine has always been the mainstay, the pillar of nicotine replacement therapy. So when we advise patients to quit smoking, nicotine replacement therapy in the form of gums, patches, has always been part of that mix along with psychosocial support. So nicotine has really been studied for its safety in human conditions over the last 5 decades. Big Pharma has done exhaustive studies on nicotine to make sure that the nicotine replacement therapy can be on the market. So it would be very strange if nicotine were to suddenly become the enemy. The fact, your question about whether it's dose dependent, now that's a very insightful question because Paracelsus said it's not the poison, but it's the dose. Because in essence, almost anything that we consume can be poisonous, but the dose makes the difference. Now, this is why nicotine is really quite interesting, because if you do a study of how many nicotine overdoses there are that turn up at the accident and emergency clinic that Dr. Leroux was a doctor for so many years, you don't find that. And the reason is that nicotine is naturally in people expelled. They get nauseous and they start vomiting. So it's actually quite difficult to get a nicotine overdose, although it is possible. And it's very important to make sure that the dose of nicotine in each of these products is very strictly regulated. There was a time when illicitly traded oral nicotine pouches from the East Asian region had up to 60 to 90 milligrams of nicotine, which is pure poison. So that's where you as regulators can come in and make sure that product standards are set, that nicotine limits are set. And to give you one other country where they've gone through the policy making cycle is Germany, where in consultation with their local SABS, the equivalent of our SABS, which is the BFE in Germany, they came to what they would regard as the recommended maximum dose of nicotine in any of these products, and that's about 19 milligrams for each of the pouches or the doses of the vaping devices. So nicotine is central to the bill, and it's really important to make sure that it is not criminalized, because nicotine per se, and I think Professor Valodia mentioned this, there's very good evidence that nicotine can be beneficial in conditions like Parkinsonism, ulcerative colitis, some forms of attention deficit disorder. So it's really important to keep a balanced and evidence-based view on nicotine itself. Just moving on to Dr. Leroux's question on how we can incentivize people who smoke to move from the most harmful product, which is cigarettes, to less harmful products, such as the categories that I've mentioned. And without a doubt, taxes is the most important incentivizer. What is most interesting in the Swedish case, just moving to what Honourable Member van Staden asked, the Swedes really got this right. They've been seen as a bit of an outlier in the policy-making world, also during COVID. But in terms of tobacco control, they've taken a much more pragmatic approach. Just last year, they've come out with a reduction in the taxes on oral nicotine pouches, or as they call it, white snus, and then also on the tobacco-filled snus pouches, so that there's a very clear differential, a tax differential between cigarettes, which should be which is taxed almost at 100%, and then the less harmful products, which is taxed at about 5 or 10%. In some countries, it's not taxed at all. There was also mention of the use of single-use vapes, the so-called modern disposable vapes. This has been a great debate in several countries, also our own. And this is not an easy answer, because you will find that policymakers and their discussions is often some distance from what happens in practice, because consumers find DIY methods. They have workaround methods to still get the dose and the liquids that they need. So it is difficult to say that I'm either for or against disposable vapes. The one advantage of a disposable vape is that at least the regulator and the regulator keeps the manufacturers honest, and they can do spot checks on the ingredients of the disposable vape, so that it might be better regulated. But on the other hand, the environmental burden is such that it makes a very difficult policy making process. I think in general, you want to start with the vaping category to make sure that proper product standards are in place, and that you don't get the open systems make it possible for any of these e-liquids to be used. And the one question asked about the e-liquids is absolutely valid. If you look at what happened in Malaysia before e-cigarettes were regulated, it's equivalent to where South Africa is now. Malaysia became the dumping ground for any kind of rubbish e-liquid from all over the world. I visited a few of these wholesalers where there would be 2,000 different flavors of e-liquids. So it's incredibly important for the South African policy machine to get this right. It's just to make sure that you don't need 5,000 different flavors of e-liquids, but limit the number of flavors and make sure that they are well regulated and enforced. Just moving on to the question on gateway, because flavors overlap that question. From public health, our fear is always that if you give child-friendly flavors in any product, it might attract children. Also, if you use descriptors that would attract children, it would attract them to the vaping products for one. And the fear in public health was that it would lead as a gateway to then smoking combustible cigarettes. Now, this is a debate is already 15 years old, almost as old as the vaping product category. And if you look at, and we will submit some of the evidence in this case. If you look at the evidence of gateway, it really, there is nothing there. On the other hand, if you ban flavors, for instance, as the Californian State Department did, there was an immediate effect on the number of people who returned to smoke. So you might have the perverse consequence of banning flavors that more people return to smoking, and that they would not be less incentivized to switch to a less harmful product. There was also a question on, it's about stopping smoking, but then moving to vaping, but in public health for one, what is our ultimate goal? Well, our ultimate goal is definitely for people not to smoke or vape. That would be the ideal. But we live in the real world, and real world science will show you that it's highly unlikely that the 1.4 billion people who smoke today will stop smoking tomorrow. Even WHO would concede that by 2050, they still anticipate there to be 1 billion smokers. Now, if you look at the scoreboard, to me, that's not success. If you can get that 1.4 billion smokers today onto a less harmful, regulated nicotine delivery system, that would be the desired state. But just to answer Honourable Member Clark's question, we found a very interesting tendency in the United Kingdom, because people who smoke, and in the UK there were 10 million smokers, and then about 7-8 years later, 2 to 3 million of them had switched to vaping, and there are now 4 million vapers in the UK. But what we found with them, and these are figures from ASH, which is an independent, consumer-driven organization that also is seen as credible by the government. we found that people stop smoking, they start vaping, then they go through a phase of what we call down nicking. They use less and less nicotine, and that 40% of those who had switched to vaping eventually quit altogether. So this is all part of what we would argue is a successful transition from the most harmful tobacco product to the least harmful nicotine delivery system, and that eventually it would also help increase smoking cessation. And that's perhaps where I can end with the questions by the chairman. So I've answered the one on the dose related and the disposables and flavors, but perhaps just to end the questions with some of the best practices. So, Honourable Member from Staden also asked about Sweden. So Sweden managed to get to the end state of less than 5% smoking prevalence in adults by a pragmatic use of regulation where they made sure that snus first and then later oral nicotine pouches were made accessible, affordable, and acceptable to the consumers in Sweden. So you would have a total nicotine use in Sweden, and this is really important to understand. The total nicotine intake per capita in Sweden is equivalent to any of the 26 other EU countries, the total nicotine per capita. But if you look at the desired outcomes of less disease, less death, less disability, you'll see that in Sweden there are 41% less smoking-related diseases and cancer. There's about 1.5 million less deaths linked to smoking-related disease in Sweden. We'll support the report on Saving Lives Like Sweden, in which we enunciate exactly what the benefits were of tobacco harm reduction in Sweden. So Sweden is the all-out world champion, and closely following them is New Zealand. New Zealand is interesting and comparable to South Africa because New Zealand first banned or had a more draconic approach to regulation of vapes and also now oral nicotine pouches. Then they reversed this position, and there's been a huge improvement in public health outcomes since they brought in tobacco harm reduction as one of the principles in their tobacco bill. We wrote a report on that, comparing Australia, which still upholds a de facto ban, and New Zealand to show the difference in health outcomes. So I would point you in terms of best practice to Sweden, New Zealand, Japan. I mentioned over the last 6 years to have 52% cigarette sales reduction we've never seen that before in my public health, never. And what we should have is WHO and all the public health bodies looking at why this happened so it could be replicated. But unfortunately, that hasn't happened. And that's really where South Africa can now move in and become, again, a world leader in harm reduction. And Chairman, to your point on HIV/AIDS, you might recall under the presidency of President Mbeki, there was, let's call it a misunderstanding of the true root causes of the HIV epidemic. And there was a complete opposition of the harm reduction methods used, except for condoms, preservatives. That was always fully backed by the department. But at the time, the antiretroviral therapy came on board, where it was clear that this therapy would help HIV sufferers to have less serious disease and actually live an almost an optimal life given their condition. At that time, there was not access to these antiretroviral therapies. And to his great credit, under the mentorship and tutorship of President Mandela, Dr. Letlapi and several of our South African colleagues marched on policymakers to try and make sure that access to antiretrovirals would be assured. And the moment the South African government changed their position on antiretroviral therapy and made it part of the public health regulation and implementation, it not only changed South Africa, but the world. I remember in practice at the time, for my HIV patients at the time, it would cost them $10,000 a year to get access to these therapies. And then when South Africa started making it possible and a new market was created through the Clinton Foundation to make sure that these products came to South Africa, suddenly the total price of these therapies per year dropped to $1,000 or $2,000. So it's all in favor of making sure that you, as a portfolio committee, look at the evidence of what is truly harm reduction, what isn't, and then to make sure that you make it accessible through a bill that's pragmatic and recognizes harm reduction as part of the total gambit of tobacco control measures. I hope I've answered all the questions, but I could spend all night answering more questions. Anything to support the portfolio committee, and we will make sure that all the questions you ask, we would follow up with the evidence pieces, peer-reviewed evidence, and also the reports that we've written, so that you have that as you continue your deliberations. Thank you so much for the privilege to be with you.
Okay, thank you very much, Prof, for the contribution. Honorable members, I'd like to also express my thanks to Ms. Machalambe and her team for putting these three presentations together that were almost like having a particular angle that they were all looking into, because we have now been able to be well appraised of these situations. I would also request that we get this report that talks about New Zealand in relation to what you have said. Initially, they went to the extreme and then they came back to another middle zone, and that seemed to have improved their public health outcome in that country because of that. Like I was saying, honorable members, we leapfrog. We just borrow from those who are ahead of us in terms of regulations and therefore and legislation, and we can learn from them and see what we can do. Honorable members, do remind me tomorrow when we log in, thank you very much, to talk about Sweden and what is happening and possibly what is likely to happen. Because again, that is another area that most of the presenters today and before have always talked about, that you think there are certain lessons you can learn from those countries. We may not be able to visit New Zealand, but so maybe lessons learned from there can assist us as we consider. Thank you very much for your information, and we'll continue to be in touch with you through our team to be enriched by your contributions. Have a good evening.
Thank you.
Yeah. Honorable members, we are meeting again tomorrow. Thank you so much for your input. We're starting, Ms. Machalambe, at 10 o'clock tomorrow. Is that so?
Yes, Chair.
Yes, please let us do that, members, so that some of the people who are traveling can be free to travel in the afternoon. Thank you very much. Have a good evening, honorable members. We'll meet tomorrow.
Thank you, sir. Thank you, Doctor.
Thank you,
So we are not on leave, no?
Bye-bye. You will work even when you are on leave. No, I'll forward you a document that says, let us work on legislation even if we are on leave.
Bye-bye.
Bye-bye.
Thank you. Bye-bye.